with support from Red Cross Mental Health Collaborative and all the agencies that will be presenting today. Okay, so I know you didn't join just to listen to me, so let's get to the exciting part. I'd like to introduce our first speaker, a highly reputable and sought-after psychiatrist, Dr. Olgun Sina. He is a consultant psychiatrist and assistant clinical professor at the U of A. He also has a fellowship of the Royal College of Physicians and Surgeons of Canada, is a fellow of the British Royal College of Psychiatrists, and certified by the International Society of Addiction Medicine. I, for one, have referred many individuals his way over the years and seen some great outcomes. So Dr. O, if you can unmute and share with us some of your perspectives about mental health in this community, what you're seeing and what you want the community members to know. And just a reminder, if I can ask everybody else to unmute so that we can hear from Dr. O.
Oh, thank you very much, Samra. Can everyone hear me? Yep. Okay, great. Thank you. So I think I'll start off with, just talking about what mental health awareness is. Mental health awareness is all about recognizing or appreciating that our psychological health is a very important aspect of our whole health. But also appreciating that the impact of mental illness is not just on ourselves, but also on everyone around us, our families, our friends, and the society at large. Mental health awareness also, describes how our mental health affects our day-to-day functioning, our schooling, jobs, and interaction with other people. What we feel in our bodies, our thoughts and emotions, they're all very important aspects of our mental health. And being aware of our mental health helps us to understand ourselves better, but also helps us to understand others better. And in that way, it reduces the tendency for us to jump to conclusions. Especially when we see, behaviors from other people. And as a result of that, it also reduces the stigma that is often associated with mental illness, because there's often this, the assumption about, mental health in the society at large. The good news is that mental health awareness is increasing. We now have more teaching in schools, in the news media, online, and more people are, becoming aware of mental health, and also as a result, less judgmental about mental health issues. So it's good that we're having more and more awareness in society. It's good to talk about mental health because by opening up the conversation and sharing experiences helps all of us to dispel some wrong beliefs about mental health. Now, what is mental wellness? Mental wellness is described as a positive state of mental health, not just the absence of mental illness. And when we are able to think, feel, and act in ways that create a positive impact on our physical and social well-being, that is what is described as mental wellness. Now, why is mental health important? Mental health is very, very important because the onset of mental illnesses are usually in a very, very young age, like in adolescence and young adulthood, and this is affects the educational achievement that young people can have, and also that translates also to occupational and employment opportunities that we can have as adults. Mental health awareness is also very important because it affects the formation and the nature of personal relationships. So you can imagine if someone becomes unwell very early in life, that affects their future relationships and how they interact with others. And there is also evidence that the greater the number of episodes of illness, the more the likelihood that the long-term outcome would be negative, and that there's more likelihood that there will be greater disability later on in life. So it's really important that mental health issues are addressed very early so as to have a better long-term outcome. The awareness of mental health is probably also very relevant at this time of pandemic because there has been a very significant increase in mental health disorders because of the pandemic. There is increase in substance use, there's increase in suicides, in depression, in anxiety. We've seen a lot more cases since the pandemic started. And this is because the COVID-19 pandemic has associated with a lot of distress for people and a lot of anxiety, a lot of uncertainty. It's affected on people in their personal lives. There's unemployment, there's social economic difficulties, very chronic stress, very, a great worry about contracting COVID itself. So this has affected, mental health a lot, and we've seen quite an increase in people becoming unwell, and people that also have a history of mental illness most have, gotten worse since the pandemic. Now, I would just describe very briefly what causes mental health instability. Just like any other chronic medical disorder, mental illnesses also have a very strong association with genetics. So hereditary factor is very, very relevant in mental health. Also, adverse childhood, early childhood experiences has been one of the factors that has been associated very significantly with later onset of mental illness. So people having very traumatic experiences in childhood are more likely to present with mental health problems as adults. Substance use is another factor that has also increased during this time of pandemic, but has been associated a lot with mental health problems as well, both drugs and excessive use of alcohol. Even though one can lead to the other, for example, you can have people trying to self-medicate with drugs or alcohol to manage their symptoms. But in itself, the drugs and alcohol can also predispose or make us vulnerable to developing mental health problems. I think the last thing I'll probably talk about is the stress that is also associated with mental health problems. Excessive stress can be a very important factor, and that could be in the form of come in various ways, like pressure at work or pressure at home. It could be from traumatic experiences that cause a great deal of stress. But we need to be careful that stress is not really a bad thing because sometimes some stress can be positive. For example, if you have an interview coming up, or you having some stress actually could be a positive thing in helping you to prepare for a test or an interview in our lives. So stress is not always a negative thing, although people cope with stress in different ways. Some people are more able to cope effectively with stress than other people. But long-term stress can be very damaging to our health. It can affect our immune system. It can affect our digestive system. It can affect our sleep. And all of this can make us more vulnerable to having physical and mental health problems, such as depression and anxiety. Now, how do we recognize the symptoms of mental health problems? Some of the very common mental health problems include, anxiety, depression, bipolar, schizophrenia. These are some of the common ones that we're aware of. Now, just like any part of our body can break down, our nervous system can also break down, and some are more vulnerable than others. Some of the symptoms that we can identify as or recognize as mental health symptoms include when we have a lot of anxiety, when we worry excessively over every little thing. Sometimes the worry may be in certain situations. Maybe for some people, it may be in a social setting that they find themselves worrying excessively or developing a panic attacks or panic symptoms. Mood problems is another common symptom whereby people feel excessively sad. They're having mood swings or extreme mood changes, very happy 1 minute and then very, very, very sad the next. Having very strong feelings of irritability or anger. Sometimes it may manifest in our behaviors, for example, isolating ourselves or avoiding friends and social contact or activities. Changes in sleep can be a very sign, a very important sign to watch out for in mental health. Either excessive sleep or inadequate sleep. Sometimes some people wake very, very early in the morning, and that becomes a problem. Same thing with appetite. Sometimes it could be excessive. Sometimes it could be very, very poor appetite. One symptom that is also very, very important is when our day-to-day functioning becomes impaired. This is also a very strong pointer to something not being right. Having very low energy or feeling very tired all the time, not being able to concentrate. Now, for majority of these symptoms, it's not just about having it, for a day or two, but when it becomes a pattern, and when it becomes, when we see that it's affecting every area of our lives, then that is very, very significant. Sometimes when people become psychotic, they could have extreme paranoia, having beliefs that someone is coming to hurt them or harm them. Whenever we see any of these symptoms, it's very, very important that we seek help and we get help to be able to address them. Now, what can we do to achieve stable mental health or to maintain stable mental health? One is to be aware. So educating ourselves about mental health, recognizing the symptoms of mental illness, these are very, very important. But we also need to be very careful that we don't become addicted to negative news, because there is a tendency that, yes, you're trying to find out more, but then, especially in this time of COVID, people can become very glued to their TVs watching COVID-19 news all day long. That can be a very negative thing as well. So we need to be very careful about that. It's good to be aware, but also we need to be mindful not to become addicted to negative information. Now, being aware also includes, increasing our awareness to dispel wrong beliefs. This could be family or religious beliefs, for example, that we don't need assistance, or we just need our willpower to deal with our mental health struggles. This actually makes people to miss very important assistance and opportunities. Now, getting adequate sleep is very, very important. Having a routine with your sleep pattern, having a schedule on a day-to-day basis, time that we wake up in the morning, time that we go to bed, having that routine sounds very simple, but can be very, very helpful for our mental health. Our dietary habits also is relevant, eating, healthy food and avoiding junk food. There is some evidence that plant food, fish, and regular meals are associated with better mental health. So we need to pay attention to that. Exercising getting very regular exercise, can help our mood. Just 30 minutes of walking every day can actually boost our mood and improve our health. And there is evidence to show that aerobic and strength training reduces depressive symptoms. And regular exercise also can reduce anxiety and panic attacks. Relaxation is another area that helps us with mental health. Practicing a very relaxing activity, muscle relaxation, breathing exercises, meditation. All these things sound very simple, but they make quite a difference in helping us to relax and improving our mental health. Now, simple things, even just like going for walks in nature, can be very, very helpful. Now, setting goals and priorities, is important because sometimes we find ourselves just in a hurry all the time. We want to, just in a rush, and that increases anxiety. So learning to be able to say, stop, take a step back, take a breath, can be very helpful in helping us to maintain mental stability. So it's sometimes we need to ask ourselves what needs to be done right now. I mean, what can wait? And rather than wanting to do everything all at once, and learning to say no is very, very helpful as well, because sometimes we find ourselves overwhelming ourselves with a lot of things, new tasks, and then we're not able to cope. And then that results in feeling low and feeling very, very anxious. So learning to say no sometimes to new tasks when we feel overwhelmed is helpful. We talked about alcohol and drugs earlier on as one of the causes of mental health problems. So avoiding alcohol and drugs, is important. Again, especially in this period of pandemic, because we are isolated, we're at home all the time. Tendency is to, have more than the usual drink. And sometimes also because of the isolation, people are more prone to using substances as a way of coping with the loneliness or isolation. But we need to be aware that this may predispose us to becoming mentally unwell. Now, there are some other things that we can do with other people as well, like connecting with people, contacting people. Sometimes if it's not possible physically, maybe using technology like phone, like video chats. We can use that as so that we don't feel isolated. Now, we all have strengths and weaknesses, but trying to find how we can do things together, do activities together, probably do some games together, can be very, very helpful for our mental health. Having discussions with other people and also sharing with other people is another way to promote our mental health. So it's also very important to reach out to vulnerable people. So we need to remember that there are some, especially the elderly, people that probably have are very sick, have severe illnesses, people that have probably developed COVID-19. We need to reach out to these people to give support to them. There is actually some research evidence that shows that conducting acts of kindness, such as spending money on other people, on others, may actually increase our subjective well-being. So it's a good thing to do that. One other thing is practicing gratitude writing. So being able to just, remind ourselves what am I grateful for today? What am I thankful for today? That helps, in our way of thinking, because we all know that the way we think affects the way we feel. So trying to change our pattern of thinking, encouraging ourselves to, probably think of something positive about your day, and practicing gratitude writing can be very helpful. And we should remember that treating ourselves with kindness is very, very helpful for our mental health. Now, I think I'll probably pause there if there are any questions right now.
Thanks, Dr. Organcina. We do have a few questions coming in. One of the questions we have here is, do most patients require medications for mental health? And if not, what other avenues are there and what have worked well in your experience?
Not everyone needs to be medicated. Usually most mental health disorders, we categorize into mild, moderate, or severe, just to simplify it. And in most mild cases, what could be very helpful are simple things, just like problem solving. Well, what is the practical ways that we can address the problem? And therapy is another thing that can be very, very helpful for mild presentations of maybe, for example, mild depression or mild anxiety. Doing therapy, counseling can make quite a difference. And counselors are also very good in helping us to problem solve. Exercise is one thing that, as I mentioned earlier, that helps with our mood and can also help with anxiety. So regular exercise is one other thing that we can try to engage in on a regular basis. And simple things are, like I mentioned earlier, about our pattern, our sleep pattern, observing that, trying to get good sleep, doing relaxation. All these simple things sometimes can go a long way in helping us to recover from mild cases of mental illness. However, in situations whereby the severity of the condition is moderate to severe, especially when it's severe, we will need the help of medication in most of those cases, simply because when we have severe symptoms, in most of the time we cannot concentrate or focus, and it's very, very difficult to function. And so you can imagine problem solving in that kind of situation will be very, very difficult, or even doing therapy will be very difficult. So you need some medication to help us achieve a degree of stability. So, and then from there we can now build on that with other forms of therapy. So yeah, so it's not in all cases that we need to be medicated, but I think it depends more or less on the severity of the condition.
Thank you. And another question here is, since wait times are so long here for psychiatric consultations, what do you suggest one should do if there's an urgency, and what would qualify as urgent?
Right. Okay. If anyone is feeling suicidal, that will be considered as urgent. If at any point anyone is posing a risk to themselves or posing a risk to the public or the family or children, those are very, very those are crisis situations that needs to be addressed very, very urgently. There are various ways to address this. So, for example, if this is happening at home, the family can help the person to access the crisis nurse at the ER at the local hospital. If it's a situation whereby it's very difficult for the family to maybe convey the patient to the hospital, or they're not able to handle the situation, it might be advisable to call for help, call the crisis line, or call the police for assistance if it's a situation that that poses a lot of risk. So for crisis situations, yes, there is a crisis nurse at the hospital. The patient can be taken to the ER, will be seen by the ER doctors or the crisis nurse, and then from there on will be managed as appropriate. But if it's not a crisis situation, we have a lot of resources to access. One would be our local family physicians. We can go there and speak to our doctor about our problems. There is the Abata Health Services counseling service at Timberley here in town. And we also have mental health help from the primary care network, which is also at Timberley. There is the Canadian Mental Health that is, they also have a lot of resources there, even online. You have both virtual and in person. So there is a lot of local mental health resources that we can access, both in crisis or non-crisis situations.
Thank you. Another question here is, from the symptoms that you've mentioned to look out for, how can we determine if it is just a phase one is going through or there are underlying mental health issues? And how long is it safe to monitor such symptoms before reaching out for help?
Yes, that's a very good question. I think the key there is the pattern and the duration of the symptoms. As I said, we all can have difficult days sometimes, maybe a difficult day at work or at school, and we're feeling a bit down for a day or two. But by the time it's becoming persistent, by the time it's getting prolonged, more than 3 days of feeling continuously down or feeling anxious all the time, that becomes significant. And generally, depression is described as whenever we have low or sad moods and loss of appetite, loss of sleep, when we lose interest in things, and all these symptoms are persistent for up to 2 weeks or more. That is defined as an episode of depression. So if the symptoms that we're having is persistent, prolonged, and it's affecting our day-to-day functioning, then I would say that is significant.
Thank you. And the questions are pouring in. It's not often that we get to hear from an expert in your area. So one of the questions here is, some people want to go to someone from their own culture or who understands their background. If that does not exist here, what can they do?
I think your family physician would probably be your first port of call to have that discussion, to see whether it is possible to access that. And also, the Canadian Mental Health is a very good resource as well when it comes to providing information about mental health resources locally. And if there are the relevant information for such a person, I think these 2 areas of resources would be very helpful.
Is there an age group that is higher, or we should be more watchful for? And when is it that we should seek help? So I think you touched on the second piece, but just on the first piece in terms of demographics.
Yes, the vulnerable age groups are usually the extremes of life, the elderly, and also the younger age group, because these are people that they need help. They need help they need assistance, they need support. So these are the very vulnerable. I think very, very important to make sure that we are providing adequate support and help for them. The younger age group, the adolescent and the young adults, that's a very important age, because as described earlier, this is the age group whereby most mental illnesses the onset of mental illnesses tend to be around that age group. And this is when people are being introduced to various things in life as well, for example, substance use. And so you have a lot of people presenting around that age, the adolescent and young age group. And because of the impact that this can have in the longer term, it's really, really important, both on their career opportunities, their educational opportunities, the relationships that they can have in future. So this is a very, very important age group to make sure that we provide help for them. And also, as mentioned before, the earlier that we are able to intervene, the better the long-term prognosis is. So because the more episodes of mental illness that people have, the worse the likely prognosis in future. So addressing that very, very early is really, really helpful.
Thank you for that. Another question here. You spoke a little bit about the impacts of COVID. So how do you think COVID has affected mental health in your experience? Which groups may have been impacted the most? And do you see a lot of individuals coming from different backgrounds trying to access these supports and services?
Yes, COVID-19 has affected everyone. I primarily see mostly adults, the adult population from age 18 upwards. So in a way, most of the people that I've seen are probably in that from that age group. But generally speaking, COVID has affected everyone. There have been more new cases of mental health problems, and even people that already have a pre-existing condition of mental health are also becoming more unwell and are presenting more. So we're seeing more and more cases because of COVID-19, and I think the various factors include the restrictions and the isolation that and also the worry about the COVID-19 itself, the fear of contagion of COVID-19, the uncertainty. I mean, this is an illness that is still largely unknown, and so that uncertainty creates a lot of distress, a lot of anxiety for people, and that worsens anyone with any pre-existing condition, and also creates mental health problems for so many people. So I think it's a wide range of people that have been presenting with mental health problems, from mostly in the adult population that I've been seeing. It's been quite widespread.
Thank you. In your experience and the work that you do you feel that there is adequate supports and services for individuals with mental health challenges in this community?
No, we need more help. There's no doubt. I mean, there is a very, very long wait time to see a psychiatrist locally. It takes several months, and it's not acceptable. So together with the chief psychiatrist in town, we've been working very hard with the Mental Health Services to try and secure more psychiatrists for the community. And I think currently there are discussions about getting some help. I think we've had probably some interest as well. So hopefully with the assistance of the Mental Health Services, we should be able to have more psychiatrists coming to the town, because it's a huge need for the community. So I don't think we have enough support. But in saying that, I mean, if I compare it to so many other places that in Canada, we still have very, I think we still have much more than other places. Because there are places, some of my patients, for example, moving out of town sometimes, they do come back and say, I have to keep, my appointment, because where I am, there isn't any help at all. There is even no psychiatrist. So we're thankful for that. At least we have 4 psychiatrists in town, but definitely we definitely need more.
Yeah, I agree. And we're very grateful for the ones that we do have. So thank you. In terms of just the stigma around mental health, what would you recommend we can do to help reduce that stigma, especially with newcomers coming from places where mental health isn't really talked about? Yes.
This is very, very important, and that's been an ongoing issue for quite some time. The stigmatization of mental health. And I think a lot of it is because of the ignorance about mental health in general, and the misconceptions about mental health. So one of the ways by which we will probably try to address that is education. Education and increase awareness. I think it's good that we're having this discussion right now, because this is part of awareness in mental health. So having more awareness of mental health helps to actually dispel those myths about mental health and the wrong beliefs that many people do have about mental health. So education, increasing awareness is very, very, very important. And also, I think, for us as individuals as well, trying to, engage more with other people, interact more with other people, understand their problems, understand the impact of mental illness on their lives, is one way that which we can also help to reduce that stigma.
Thank you so much for that. We do have some more questions. Just mindful of time, I wanted to give you an opportunity, Dr. O, to add anything else you wanted to add. And for those whose questions might not have been answered, we are going to be rolling up the questions, sending them out, and sharing that along with the online recording after the event.
Thank you. I think one of the things I want to mention is about, how we regulate ourselves, how we evaluate ourselves. Treat yourself. And are you being kind to yourself? So one of the ways to evaluate ourselves from time to time, I think, is being, asking ourselves that question: how am I treating myself? Am I treating myself well? In my mind, how am I thinking about myself? It's very easy for us to treat other people, nicely and with kindness, but then sometimes we don't treat ourselves the same way. So in as much as we can treat others in a positive way, we should go out of our way to say, I need to treat myself with kindness as well. So, and how am I treating other people as well? Am I being empathic to other people? Am I being grateful for my day? Am I being thankful for the good things in my life? Am I being stressed? Am I being excessively worried? So asking ourselves these questions, trying to identify or label the feelings that we're having can be very, very helpful. So remember to take a step back. Remember to rest very well. Eat healthy, exercise regularly. Remember to support other people. All these are very, very important ways for us to maintain not just our own mental health, but also to help others.
Thank you so much, Dr. O. Some very valuable insight and perspectives for sure. Like I said, it's not often that we get to hear from experts such as yourself. So I know myself and everybody here really appreciates that. And I've certainly made a lot of notes for myself. And one big one here is learn how to say no. So I'll be listening and taking a lot of your advice, and I'm sure many others here will too. Again, really appreciate you joining us today. And there were some additional questions that we will follow up with you on so that we can share them along with the recording. Thank you.
Thank you. Thank you. Thank you. Thank you, Rita.
Okay, next on the agenda, and we've started out really well here, so we're going to keep going. We have, trying to multitask here, the Canadian Mental Health Association, Jackie Everson, Senior Program Developer, will be presenting on their programs and services. So I'm going to hand it over to you, Jackie, and just let me know when you want me to move to the next slide.
Wonderful, and thank you. And I also have my colleague here with me, Jody. So she will be jumping in throughout the presentation as well, just to speak to her own programmings to give that justice. I don't want to mess that up, but yeah, very happy to be here. Thank you for having us. We'll take the time here just to go over kind of the programs and services that we do have, and then we'll end with provide a little technique for you all that you can take with you. But it was so wonderful to hear, from the expertise in our region here around where we're missing and some of the gaps. And then, so it's really nice for us to follow, because we do consider ourselves at CMHA a lot of that gap service. So when we see our clinicians, doctors with long wait lists, that's when you can come into community programming, and we can support you, while you wait to get into professionals and to see your therapist or whatever that looks like. So happy to follow up here with some of these services that we can provide. So we are Canadian Mental Health Association, which is wonderful. If you want to go ahead and switch slides there. CMHA is a national organization, so all the way across Canada, you can find CMHAs. It's been in our region here now since 1984, so it's been around for quite some time. I think across Canada, we started in 1918, so quite a significant period of time we've been here. Our vision, of course, is mentally healthy people in a healthy society. Lofty goal, but it's certainly our vision. And then our mission as an organization, to be a leader and champion for mental health. CMHA Wood Buffalo, we of course provide services and facilitate access to the resources that folks require to maintain and improve their mental health. Our efforts to promote community integration, build resiliency, and support recovery from mental health and addictions is, of course, our number one goal here. Our values within the organization, feel free to switch slides there. Of course, we embrace the voice of people with mental health challenges. That's a big piece of the work that we do, listening to folks and taking in their experiences to help us improve our programming, promoting inclusion. We enjoy working collaboratively, of course, with other organizations and just folks within the community. Influencing, we want to have an influence on the social determinants of health, of course, very important for us, with a focus on mental health needs for all demographics within the region. We use evidence to inform all of our work. We don't pull anything out of the sky and just make it up. We listen to the professionals out there. And then, of course, we do believe in transparency and accountability when it comes to delivering our services. So that's just kind of an overarching idea of us as an organization, and of course, any region, any other region that you visit with across Canada, same kind of values and mission across the country. So, okay, moving into some of our programs. So these are what we consider to be our wellness programs. These are the ones that we offer in the community that help to build our community capacity. So for other folks within the region that are working with people that may have mental health challenges, these courses are really great for those folks. So we'll look at, we have our mental health first aid, which is a 2-day course that teaches us about mental health and mental illness. We learn how to offer, of course, first aid to a person experiencing mental health crisis. So that's that program. Then we have our assist program, which is another 2-day course that trains participants to support another individual who is at risk of suicide and offer that suicide intervention. So it goes just one step further into our intervention. We have Straight Talk, which is a half-day workshop for folks that are working with individuals that are between the ages of 12 and 24. And this is where participants learn about the risk and the protective factors as they pertain to our young individuals who might be having suicidal ideations or just talking about different mental health challenges. And the last one that's part of our wellness programs is our Tattered Teddies. And this is another one. It's a half-day workshop that we provide that just kind of provides individuals with some warning signs indicating risk of suicide in our children. So this is in our really young children. So this is, we teach folks how to talk with their child and then of course connect them to the proper resources, the proper helper in the community if they're dealing with suicidal ideations as well. So those are kind of our top 4 wellness programs that we offer out to community, again, to help build up community capacity so we're better to support each other in the region. So those are our wellness programs. another part of our programming is within our community, our consumer advocate. So this is an individual that works within our organization, and they are able to provide one-on-one support with folks that are dealing with mental health challenges, but are also looking for support in other areas within their own day-to-day lives here. So some of the supports that they can help with, of course, are with financial assistance, application, appeal processes. They can support individuals with that. They can help with referrals to low cost or free therapy counseling services, depending on circumstances there. They provide, of course, mental health education and support for various caregiving positions, help locating affordable housings and subsidies if that's something that you are looking for. They support with landlord-tenant concerns or disputes, helping locating different programmings if you need to get into any kind of recovery programming, employment training, anything to do with kind of educational development, they can support in getting enrolled in those programmings. And then, of course, other supports that are unique to your needs, you can bring those forward to our consumer advocate, and they can help navigate the systems with individuals one-on-one, and keep people at least connected to different services. So that's our consumer advocate. And then we have our School for Peer Support. And right now, this is currently on hold just because of COVID, but we will be introducing this again in the new year, which is very exciting. So this is kind of a cornerstone program for us. This is how we start to build our peer support capacity within the community to help us run our various programs. So we take folks that have lived experience with mental health and or addiction challenges, and we provide them with educational training programs that help them use their lived experience to then go out in community and support others who might be finding they're having challenges with mental health and or addiction. So this is a great program for us. Again, we provide all the training, placements if that's something that folks are looking for, so that they can go and use their lived experience in a very safe way to support others on their healing journey as well. So that's our School for Peer Support. And then Jode's going to speak to our Caregiver Connections program here.
Yeah, I'll take over. I hope you guys can hear me. I don't think you can see me. I have my video on, but I can't see me. So anyways, it doesn't matter as long as you can hear me. So yeah, I'm a member of our Caregiver Connections team. And so what exactly is Caregiver Connections? It's a program offered through CMHA to support caregivers in our community. So caregivers who are supporting someone who has a mental health or an addiction challenge. So our goal is to, support those individuals who are caring for others. When we first started out, our focus was primarily on, parents, spouses, family members, but we have identified there are so many more caregivers in our community. So these include, teachers, coaches, frontline workers, all these individuals do provide support for individuals. So we want to be there to support them as well. Why is it in our community? We believe offering this peer-led support groups, really help grow our capacity to help others. So the last, I would say, since the fire, we've had fires, we've had floods, we've had COVID, we've had an economic downturn. So we've had all these things happen, and we really need to be there to support those caregivers so they can be of support for others. Because I think everyone can agree the mental health in our community and for our community members has definitely declined. And we've seen, a huge growth in the caregivers as well. So that's kind of why we're here. If our caregivers aren't good, then we can't really be of much support to those who are struggling. So that's why we are in the community. We can switch slides. Who can participate? Anyone who cares for someone who, might have a mental health or an addiction challenge. And like I said earlier, this could include frontline workers, teachers. We've noticed in the community, a lot of youth are struggling. So teachers, whether they recognize it or not, they have been thrown into this caregiver role. So yeah, anyone who is supporting someone, we are here to support you. And that could even include, you know, if you're supporting elderly parent or an elderly spouse, like we're here to support you. So it doesn't necessarily just have to be, you know, parents or spouses. Anyone who's supporting someone, that's who can participate. And the program's funded by the Government of Alberta and the Ministry of Children's Services. So that's where our funding comes from. And yeah, it started in 2016 after the Fort McMurray wildfires. And I believe, I know here it says 6 regions in Alberta participate, but I think we are up to 8 now, which is really encouraging. Who leads the session? So all our facilitators and members of our Caregiver Connection program are trained peers who have that lived experience. So when you come in to talk to us, we have that background of being a caregiver. So it might not be the exact same, you know, experience you have, but there is that that experience there, and it really allows us to connect with each other. So yeah, that's who leads the session, trained peers who do have that lived experience as a caregiver. Okay, so I'll just touch base briefly on the 3 main services we do provide. So we can actually click to the next slide. We do one-on-one peer support. So again, this isn't counseling or therapy, but if you're maybe in between sessions or you're just really struggling and you need someone to talk to, you're able to come in and talk to a member of our team. And again, the person you're speaking with does have, you know, experience in this. So it really creates space for individuals to talk about their struggles and share those experiences. And we can also help, you know, if you don't know where to turn, maybe you're supporting someone and you don't know, you know, where to look for counselors or therapists. You just really don't know where to start because it can be extremely overwhelming trying to navigate the mental health system. We can kind of guide you along that way as well. So yeah, we're there to talk, to listen, and also to help connect you with those resources in our community if you are unsure where to turn. Support groups and courses. So we've just started a once-a-month support group. So if you're a caregiver, you can come in, and it's just a very informal group where we can just talk and share our experiences and stories, and just to let people know, you know, you're not alone. And it's really powerful how you can learn from someone else's experience as well. So that's our support group. Our courses we offer. So we offer Empowering Helpers. This is a class directed just at the caregiver. So how we can support ourselves and make ourselves the best version that we can be. We talk about boundaries, how to support someone versus, you know, trying to fix someone, those healthy relationships, all types of self-care things along that nature. So it's focused directly on the caregiver. And we recently started, I would want to say like 6 months ago, we have a series of courses called our Knowledge is Power series. And these are just educational pieces because we found that, you know, it's hard to support someone when you don't understand what they're going through, right? So when you don't have that background, it can be very difficult and very overwhelming. So we have a bunch of courses, you know, like anxiety, depression, like self-harm, trauma-informed care, all these really great courses that give us the education that increase our capacity to care for those who we are supporting. So that's our support groups and courses. And again, they're all free of charge. I should have mentioned that as well. Community education. So we'll go out into the community and host presentations, attend community events, and we love to partner with other organizations to share those resources, just basically educating the public and letting them know, you know, there is a place for our caregivers to go to receive support. So yeah, at any time anyone wants a presentation, we are here to do that. We love sharing. And yes, I will pass it back over to Jackie. I'll pass the torch.
Awesome. Thanks, Jude. Yeah, great stuff with our caregiver programming. So okay, so to go back kind of into more of our programming. So this is probably some of the language that maybe you've heard around community, around the Recovery College. This is our big foundational program within the Recovery College. It houses many of our different programming. So within Recovery College, that's where you'll find your caregiver supports, as well as our youth supports fall under this umbrella as well here. So I'll just kind of break this down when it comes to our Recovery College, because this is the place that if you are on a wait list and your therapist, your counselor says, go to the Recovery College as a gap service, this is where you can come. And as Jodes mentioned, we have group work, one-on-one support, and all of that. So within the Recovery College, this is a big piece for us here. So we use kind of an educational based approach here that focuses on helping people recognize and develop their own resourcefulness and awareness in order to support themselves and their loved ones on their recovery journey. So this is where we really start to take some tips, some techniques, some tools, and we really start to apply them to our everyday lives. All of our courses within the Recovery College are co-developed and co-delivered with our peer support workers, as well as community members. So we will bring in community members and chat about challenges that they're experiencing, and we'll develop courses based on those challenges. So it's very, very specific to our region's needs, the courses that we develop within there. Of course, we look at it knowing that students are experts within their own recovery. They know what's best for them. We just have to start to unpack that stuff and bring it to the surface. So again, we can dive into that self-resource, our self-resourcefulness that we do possess to continue on with our journey. The other big thing here within the Recovery College is, of course, we do focus on our strengths. It is a strength-based approach. So we spend a lot of our energy focusing on what's strong versus what's wrong, which tends to be, how we approach other conversations with all the things that are wrong with us. We try to look at all the things that are right with us and work with those spaces. And it's really important that within the college, the overall, our overarching goals here is to really instill that sense of connection, the sense of hope, and a real sense of belonging in community when you're in our space. So we try to take down a lot of the clinical side of it, and we really focus on just creating that sense of connection and the lived experience that we are able to bring into our classes and our sessions is really what helps folks feel hopeful around the future of kind of recovering from whatever it is that we're experiencing. So philosophy within the college, of course, we all have lived experience that work at our facility here locally, which is really nice. But it does support our philosophy in the sense that recovery is possible for everyone. We're all on our own journey here. Recovery is not a journey, is a journey, not a destination. And we do feel that connection is at the heart of recovery within the college. So we know that it's possible. It takes work. It's not something that you graduate from, right? Recovery is about a lifestyle. It's about a coming back to self and understanding who you are so that in moments of turbulence and challenges, you know how to connect and how to lift yourself back up out of challenging situations. So that's our philosophy there. Okay, so these are some of the courses. So when we're talking about the courses that we offer, these are just some of the ones that we have listed here. Jody had mentioned a couple other ones that we do have within our Knowledge is Power series. But when we talked about some of the lessons that Dr. O was providing us around being able to say no, right? This is something that's very important for our mental health and our well-being. So we look at courses like Building Better Boundaries, which is more around our healthy relationships. That's where we learn how to say no, right? These are the courses that teach us these really important tools to help us maintain and or improve our mental health. So those are just some of the courses that we offer within the college. And then also within the college, we have one-on-one peer support, as Jodes mentioned there. We, all of our staff and our peers, they've gone through our peer school. They are certified to be able to offer one-on-one peer support. And again, this is all about supporting folks in that moment, right? In the moment where we're feeling distressed, You could come down if you can't get in to see your doctor or your counselor. This is a place where you can come down and just have that conversation, very informal, get whatever it is you need off your chest, maybe come to some type of problem solving if that's what you're looking for, but just a place to be able to talk that out in the moment without having to wait to see a doctor and that, because we do know that those wait lists are very long right now. And then we also provide individual learning plans. So this is something that you could sit down with us. We're going to look at it. We're going to chat about what it is that you're hoping to accomplish, looking at some of those hopes and dreams and goals, and looking at your personal strengths, previous experiences that you've had. We tie all of that together and we look at what's the best approach for you moving forward while you're accessing our college, our space. But then it also is a place that you can provide some notes and different comments that you may have seen if you're taking courses, and you can bring this package directly to your therapist or your counselor to have the conversation around what's going on there. Perfect. And so this is just, again, around the Recovery College, what we talked about there with that sense of creating the hope, belonging, and connection. And then, of course, we do have that educational component where we are doing skill development. So within that, we're really trying to work on establishing all of these components for folks the moment that they walk through our door. We're really trying to instill that hope, creating that sense of belonging, connecting them to whomever needs to be connected to. And then, of course, if you do enroll in programming, we're developing skills along the way that you can either share with your family, your loved ones, or just use for yourself. So more on those competencies. So within our Recovery College, we also have youth programming, and this is new for us as we've been moving forward here since the pandemic, really, that we wanted to get into the youth side of things. Coming from our local AHS and PCN with, again, just wait lists around trying to get into doctors, therapists, counselors, psychologists, all of that. So we said, we're a gap service. Let's create some youth programming around this to start filling some of these spaces in and keeping our young population engaged in mental health, keeping them connected. So we've developed our youth programming, and under this, we call it The Space, which just simply means a place that we can hold and facilitate wonderful conversations with our youth and all of that. So the space is more around our youth programming. Again, all develop the same philosophy we use within our adult programming, but this is just put down into a youth scaled side of things here. So we do have the same for our youth.
Yeah, and I can briefly go over our COVID update, so how we're delivering our programming right now. So we are back to delivering all our programs in person. We're obviously following the proper health protocols. So we are in person. We do offer closed group opportunities. So if you have a group of individuals that maybe would feel more comfortable being in a closed session for a variety of reasons, we do offer that, and that can be offered online or in person. So for example, we have some outlying communities that we do closed group sessions for, just because it's not feasible for them to, or there's no ability for them to come into town. So we do offer those online closed group sessions. So yeah, reach out if you are interested in that. Again, our one-on-one peer support, you can just drop in. Our front doors are open. So like Jackie had said, if you're in between therapy sessions and you just really need someone to talk to, or you have questions, feel free to drop in. There's no appointment needed, and someone will be there to support you. And yeah, coffee and connection. So we've been offering, if you want to come in, just grab a coffee and just connect with someone. I feel like after COVID, connection it's been a piece that's been missing, and we're really trying to get people to connect again. So we welcome you coming down. We have coffee, and we're all about connecting with our community. So feel free to drop in at any time between 8 and 4, or 8:30 and 4.
Perfect. Thanks, Jones. Okay, so before we move on to, again, just want to provide this little coping technique here. This is a great strategy to use, a little tool But before we move into it, are there any questions around the programming services before we move on to the technique?
Yes, thank you for that and for all the great information. Anybody who knows me knows how much I love coffee, so I'll definitely be coming down. Okay, so I'm just going to read through some questions here. How can you help if a person has a child with a disability that's in need of equipment? Yeah, so that's the first question.
Okay, Jodes, do you want to it's family? I don't know if you want to speak to this or I can speak to this.
Yeah, I was just going to mention, we do have our consumer advocate who is knowledgeable in those areas and can definitely direct and guide towards the proper resources and supports. And I don't know if you had anything else to add to that, Jackie.
No, I think that as far as kind of getting resources, getting equipment, things of that nature, the best person within our organization would definitely be the consumer advocate to help navigate those pieces.
Excellent. How do you deal with a person that has limited English and does require help? How do you deal with the cultural sensitivities and differences?
Yeah, this part is challenging for us and challenging for folks that do have limitations when it comes to the English language and that. Now we do our best to accommodate. We can work with our local MCA as far as if we needed anything translated, and providing those opportunities to sit down and have the conversations. One of the things when it comes to the barriers, we haven't really been able to address. But one of the best things that we do provide in that space, like Jodes has mentioned, is just that connection. It's the ability to just listen, even understanding that there are limitations. Sometimes just knowing that there are people here to support, that can hold space, that are willing to kind of go the extra mile to find translations can go a long way when it comes to getting the supports for our mental health. So although we may not be able to offer it right in that immediate spot, we're not going to leave you hanging. We're going to find how we can accommodate that.
Okay, and then I have a question here. Where can we get more details on the courses that you've spoken to and how to get enrolled in some of those courses?
Perfect. So we, at the end here, I'll share our website and resources in that with you, but we do have a platform, a website specific to Recovery College where you can go in and it's almost like shopping for a course. You can pick whatever courses you want to enroll in and then you just register. Again, everything is free. And then once you've registered, you just show up. But I'll share those resources at the end. I think we have a couple slides with contact information in that towards the end.
Perfect. In terms of the consumer advocate, can CMHA or the advocate support individuals regarding legal matters or court cases?
Absolutely. That's a big component of the work that that our consumer advocate does is with those legal elements. So absolutely can be very helpful.
Okay, perfect. And yeah, you can keep going.
Thank you. And I apologize. I have a barking dog in the back there that I'm ready to just have a moment with, but that's okay. That's why we have this technique that I'm about to explain to everybody when it comes to self-regulation. So this is really a great technique. It's super easy. We're all very familiar with it as far as, the stop sign goes. It's really a great reminder for us out there. So we like to kind of use this technique again. Emotional regulation, things can get going, we can get heated, and often we're very reactive. And then we end up finding ourselves probably having to apologize and saying, sorry, I overreacted, or I had a reaction that maybe didn't meet the situation's response that was required here. So again, great technique here. It's the stop sign. It's all about stopping, finding moment, creating pause and expanding that choice point between stimulus and reaction. So we can go to the first S here. So first thing we want to do really in any situation, right? We're always trying to expand that choice point, right? We're always having a stimulus. There's always a response. We want to grow the choice point before we have a reaction. So the first thing we want to do, anything comes up for us here, we just want to stop. right? Just find a moment to just pause, right? Take a breath in, go back to your breath, just stop whatever it is you're doing. Then we move into the T here. Perfect, right? Take that breath. Notice your breathing. These things sound very small, as Dr. O was explaining, right? Can be very small, but it's very, very effective for us. So we want to find that breath, take it in, notice it, right? I'm breathing in, I'm breathing out. Maybe we want to increase our breaths, just slowing everything down. So that's the second thing we want to do is take a breath. Third thing we want to do here is just observe, right? This again, creating pause, just taking a moment here. We want to start exploring, right? What are our thoughts? What's going on in our mind right now? What's creating this reaction in me? We want to take a little bit of inventory. Where is our attention focused, right? What are we reacting to? What sensations are in my body? Maybe I'm getting really warm, or I'm starting to get flushed in the face, right? What's going on with me? Taking inventory there. So you want to observe your surroundings. What's going on there? Then once we've kind of figured that out, right, we just want to pull back, put some things into perspective. And this is challenging, right? In the heat of the moment, things are kind of going on. We often don't take this, but this is where it gets, you know, really important within that self-regulation piece here, that we're pulling back, putting things into perspective. What's the bigger picture? Could there be more going on here than just what I'm seeing in this very moment, right? What's another way of looking at this situation? Maybe we start exploring the other person's side of what's going on there. Is this thought, fact, or opinion, right? Often we misguide ourselves and we start putting an evaluation or an opinion on things. Whereas if we stick to the facts, it becomes much easier for us to kind of navigate what's going on there. So try to find the facts in that space. And then looking at, is there a reasonable explanation for what's going on here? What's the challenges, right? So again, just pulling back, taking in some other perspective as to what's going on here. Then once we've done that, we have, of course, our last P here. And this is simple, right? Practice what works. If you find what's working for you, stick with it, right? Figure out what's the best thing that I need in these moments, what works for me, right? Maybe walking away is what's best for you. But what you want to do is find out in those moments, what is best for you, what fits with my values, what decisions do I need to make here, right? What's going to be the most effective and the most appropriate response, and just keep working towards that, right? We're not going to get this in the first try, but keep working towards it, expanding that choice point, and remember your stop technique. One of the best ways that we can just take a moment before we have a reaction to something we may not want to have a reaction to, that then we find ourselves apologizing for later on. So that's a great technique, super helpful when it comes to regulation. Give it a try, take note, see what works for you, share it with your loved ones. Works really well for our young folks and our families as well, that technique. Okay, so this is contact information. If anybody is interested, of course, anything to do with Recovery College, feel free to reach out to myself. There's another contact on here as well, my coworker, Katie. And then for anything that has to do with our families, peer support, caregiver connections, feel free to reach out to Jody and Krista. They're our caregiver team. Anything youth related as well, you can reach out to myself and we can make those connections as you need to. And then this is the office hour website information that we were referring to earlier. So hours of operation, we are open to the public. We're located down beside Service Canada, down on Manning Ave, phone number, CMHA's website, if that's helpful. And then of course, Recovery College, where you can find all of our courses to register, are all on that website for you. And that's that.
Excellent. Thank you so much for that information. And I'll leave this slide up if folks are taking down your contact information for a few minutes. And we will share the contact information when we upload the recording as well. But lots of really great information. I know I'll be trying that stop technique with my kids, especially here shortly. I do have some additional questions, Jackie, for yourself and Jody. is there an evaluation or screening for individuals to ensure they're suitable before participating in the caregiver program as a caregiver?
No, you know what? We don't do any screening. Everyone is welcome. So yeah, if you feel you identify as a caregiver, we are 100% here to support you. No questions asked.
Yes, that's actually a great question. For any of our programming within CMHA, other than the consumer advocate, there will be elements that everybody can go and see the consumer advocate, but of course what they can assist with will depend on many other factors. But all of our programming, Recovery College Youth, there's no diagnosis that's required. There's no referral that's required. There's no, if you believe that you should be here, then you should be there. That's the number one goal for us is if you feel like you need to be there, then you should be there.
That's excellent. Thank you. And in terms of, like you mentioned, you talked a lot about lived experience. Seems like that's kind of a foundation for a lot of your programming. Do you have individuals from diverse backgrounds included in some of that, offering lived experience, you know, folks from, say, underrepresented or visible minority communities?
We don't currently have any peers that have been able to kind of step forward and be able to, I guess, willingly, because it is voluntary, step forward and share their lived experience. I do believe that there have been some barriers in that. But we, again, opening up peer school in January, we are going to be looking at opening this up to various demographics so that we can have some culturally competent material and relevancy within our peer support and lived experience. Absolutely a huge goal for us.
Excellent. Getting some comments. This is amazing information. Didn't know there are so many resources and courses available for free. So please advertise more. That's what they're saying. I do have another question. Are you planning to reach out to various workplaces to help remove the stigma and discrimination against mental health?
Yeah, absolutely. And this comes with a lot of our community programming when we're offering presentations into community and that. And we do try to seek out workplaces to be offering mental health supports and awareness. And that's a big goal for us. Again, we do go out. COVID has obviously impacted that, but a goal for us again is picking up, getting into workplaces, reminding them about, you know, stigma and knocking down those barriers to accessing services, especially within the workplace. Absolutely.
Excellent. And I think Jody did speak to closed group programming, which I think might be something that within Markaz al-Islam is something that we may explore for some of our members, just to break down some of those stereotypes first and get people involved in accessing some of these services. So really glad to hear that you have those types of options available as well for individuals.
Yeah, absolutely. It's a big component, especially within the caregiver region, to do those closed groups with, you know, specific demographics. Our Indigenous friends really enjoy having the closed groups. Just more private for right now as they're, you know, beginning to access mental health and addiction services. It works out really well when it's a nice closed group. So yeah, we are definitely available for that.
Okay.
Sorry, I was just going to add, and like, if you do need that closed group, and we can reach out to the Multicultural Association as well, if we need an individual to come help support us in running that group, just to be mindful of the cultural differences as well. So we'll always find a way to make it work.
Excellent. Thank you so much. And thank you for all the wonderful information that you've shared. No more questions for now, but we really appreciate you being here and being willing to come and share how to access your services, what services are available. And I think more of this will really help get folks used to accessing some of these very critical and important services as well.
Well, thank you so much for your time.
Thank you.
Have a nice day.
Okay, so we're at 2:28 and our next presentation will be from the Public School Division. I am going to, oh, there we are. Melanie Fraser is the Mental Health Coordinator with the Fort McMurray Public School Division. And so I'm going to hand it over to you, Melanie.
Thank you very much. I am honored to be here. This is something that I am very proud to be a part of for so many reasons. And one of the biggest reasons is with it, as we share information as a community, we become stronger. We have the ability to really help each other, connect each other, and work through the things that sometimes could separate us in times of stress. And our mental health is one thing that is impacted greatly when we feel we're isolated. So I'm happy to talk to you today about Fort McMurray Public School Division. My presentation is not going to be about a whole bunch of, it's not going to be like a psychoeducational presentation. It's just going to be about what Fort McMurray Public School Division can offer our families. And what that is there are 16 schools in the public school division. And my role as mental health coordinator, in my actual title, it is called Mental Health Coordinator Removing Barriers. And the reason why that's put in there is it is my sole purpose to be able to work with families, work with the schools, and remove any barriers that may happen, whether it be a language barrier, a mental health concern, there may be some family concerns. I work with the families and I try to set up the best services we can within the school division. So let me tell you a little bit about our school division. So like I said, we have 16 schools, including an Islamic school that goes to grade 9. And I do believe I saw Miss Mahar Rashid on the line as well. So she is our principal there. And then we have a Christian school as well in our 16 schools. Being a part of our 16 schools, every school has a counselor. And that's an important piece to mention because sometimes people think mental health only has to do with the big, dark things, but mental health is on a continuum. And I'm not too sure where you're at in your own mental health or your own mental wellness. So it is very important that the schools give you access to counseling for your children. And with that, anytime you go to the school, as a parent, as a caregiver, you can ask for your child to have counselor in one of our elementary schools, or in our junior high schools, we also have therapists. And the difference between therapists and counselors is therapists go into a little bit more, well, they do some of the heavy lifting, let's just put it that way. They do the stuff and they help support you with some of those more complex pieces. So because we offer counseling and therapy in every school, my role as their clinical supervisor is I am constantly coordinating with them. I supervise them and we talk about cases. And whenever there's something complex that's happening in our community or a family member is having some difficulties and they need to have broach-in services or me to help them with some services, I'm invited in to do a wraparound support meeting with them. And that in our school, we have an LAC, which is the Learning Assistance Coach. We have the counselor, we have the admin team, which is the principal and vice principal. And then we have the teacher and the parents, and of course the students themselves. And this wraparound approach ensures that whatever needs this family brings to us, we're able to work with you and accommodate you and hopefully make a plan for your child to succeed in our schools. This is something we take very seriously in our schools, and I take it very seriously in my job. Another part of my job is communicating and bridging the gap with external resources and agencies like psychiatry, physicians, pediatricians, CMHA, some other solutions. All of the agencies in our community, I do a lot of, I'm like the go-between. I help support that to make sure if a family needs a certain service that we as a school division cannot provide, we can connect them with external resources. So it is very important that you know that your school can provide you with some of this by just asking the teacher. The teacher can tell you who the school counselor is, and that school counselor can reach out to you and talk about what it is that your family needs. And whether that means in school support, so your child just needs a little bit of counseling on regulation, maybe has some separation anxiety, maybe there's some concerns, maybe there's a transition recently and you've just moved to Canada. We will provide support for you and your family. As for the parents, we will provide you external support. We cannot counsel you, we will counsel your children, but we will definitely connect you with external support if that is what you're looking for. On another note, we also are very proud to have a family therapist with the Fort McMurray Public School Division, and the family therapist works with the parents as well as the children. So it's about building that relationship and whatever that is. And that is such an amazing thing that we have to offer, because a lot of times our families, with the stress they're under, they don't have a time to really work together and delve into the things that they need to work on as a family to become stronger and to move forward in a happier, healthier way. So we have a family therapist that you can access by just talking to your school counselor, and the referral could be made in. Also, we have a play therapist. So with a play therapist, for those of you who may not know, something that play therapist does, of course, is works with children with play. We do know that children communicate through play. And so we have a trained therapist on our, that work for FMPSD who actually does that. And we're able to refer to her, those families who we feel, especially those sometimes where there's a language barrier, because you don't need language to play, but you can interpret and you can, through play, work through some of these things. So a play therapist is also a very important piece of this in order for us to support you and your families. What else can I say? I'm just looking through my notes here. If you have a child that has special needs, when you go to the school in your catchment, which means your location, your geographical area, you can ask them at the office that you would like to speak to someone to find out about what supports are offered in the school. And that person would be the LAC. She or he would be the person who would help work with you with that and figure out what supports need to happen in the classroom. And if that means counseling needs to be brought on board, or if counseling, there needs to be some family meetings or wraparound meetings where I'm included, this is all parts of the support we offer. We also have a new position, what we're very proud of. Rima is our family school liaison, Islamic focus, and she is working with all of our families through FMPSD, cultural barriers, English not being their first language, so there could be some communication barriers, maybe some topics of Canadian norms, Canadian culture. Rima will be helping our families with that. So sometimes myself or another counselor will have a meeting, and we will ask Rima to join us so that she could support the family. And this way we're all feeling like we understand and we're working together. And then finally, I just wanted to bring up that we do have a website that you can go on, and navigating that sometimes could be a little bit tricky, but you will see that when you click on the website, and you could please feel free to take a picture with your phones. When you click on the website, it actually opens a link so you could see mental health and some of the different areas. If you're wondering about the curriculum, what the different schools have, what's some of the things that may be of interest to you and your child. The mental health website is great because it's for students, staff, and parents. And it will tell you which resources we have in our school and what resources in our community that we would like to share with you. So it's a one-stop all for you to find out what kind of things you would like to do and what you're needing in the moment. We also offer podcasts. So myself with the Catholic School Board, as well as a psychologist in our community who comes up, we do podcasts monthly. And those podcasts are based off of all of what parents are asking us. So all the questions, we send out a survey that's linked to our website, and you can ask any question you want. And every month we'll talk about topics that are very important to Fort McMurray community. And we're very proud of that. I'm very proud of that. And I encourage you to reach out and look at those podcasts. You can either watch it on YouTube or you can listen to it on Apple. There's many ways of accessing it and you can access that through our FMPSD website as well. And I think that is it. Does anyone have any questions?
We do. We have a lot of questions, and thank you so much for sharing all that information. I have 2 kids in the FMPSD school system, so I know that you guys do a lot of very, very good work. So yeah, just looking at these questions. Oh, and Miss Meher is attending. She said, thank you for your talk and for your time and being here today. Okay, so are school counselors in a position to refer students to mental health specialists if needed?
Yes, so if a school counselor feels that the work that needs to be done should be either the parents or the school counselor feels it needs to happen outside of the school. The counselor can make a referral. Just to be clear, there are types of mental health referrals. We have referrals to our private practitioners. You can actually go yourself, or we could make the call to help support you. So for example, often parents will say, I'm interested, who's available in our community? And we will do the groundwork for you to see which private practitioners are currently taking on new files. And then we will link the two of you together so that work is done for you. However, that is the private practitioners. So that would mean people who are doing therapy in their own business. As for mental health therapy at Alberta Health Services, that has to go through either the Alberta Health Services walk-in clinic or through Emerge or through psychiatry. So I cannot say I'm getting your referral for mental health. I would recommend to you to go to Alberta Health Services walk-in clinic, and they would give you a referral to mental health if that's the way you want to go.
Thank you. Do you find that there's a stigma in certain cultures to talk to outside help, and what do you do to assist with that?
That is a powerful question, and I'm so happy that somebody asked it. Thank you, whoever you are. I believe that there is a stigma in certain cultures, and we try our very best to kind of break down those barriers. And some of it is through education. And I don't mean education as in the school education. I mean sitting down with the counselor, and the counselor is able to explain to the individual what they can offer and what the support looks like. Because oftentimes people may believe mental health is a very scary topic, whereas our counselors and our therapists realize that mental health is your everyday well-being. That's what your mental health is. So when we are teaching you and we are learning together, so I learn how I can respond to you, you teach me about your culture, we learn to relate to one another, and then that builds a beautiful relationship for the counseling.
And speaking of your counselors, do school counselors undergo formal training?
They do, yes. So all of our school counselors, we do updated training all the time. As well, I am their clinical supervisor, so I provide them with that training, that supervision, to ensure that we are given the absolute possible support, the support that is necessary for the moment. And it is very important. So whenever an individual, a counselor is unsure of a certain topic or feels as if it is a little bit more complex, they will call me and we will debrief, and then we will make suggestions. Sometimes that means I get invited into a meeting if it's a topic that's a little bit more, we may need to explore a little bit more or offer external supports as well to bring in. But absolutely, our counselors do have training to do the work they're doing.
Thank you. Students often hesitate to reach out to their school counselors due to peer pressure. Are there resources to help those students in sending them to external sources to maintain their privacy?
Yes, I would keep that a two-part question, actually, if you don't mind, or two-part answer. The stigma sometimes is a concern, and I do understand that. We work very hard at breaking down that stigma by having the counselor coming in to the classroom often, into the different classrooms, and working with doing some universal support. So that means for the entire classroom, doing some work with them. Then each individual student start getting a comfort level with that counselor. The other piece is it's more of a positive experience in our schools. We try to encourage that if you just need someone to talk to, if you're feeling overwhelmed, you could speak to your school counselor. So we don't try to make it very heavy. And because kids are constantly being pulled for different things, whether it be extra academic work, literacy, whatnot, the ways that we avoid, and if we do have a student who has some concerns about a peer noticing this or there being any backlash, is oftentimes we don't pick them up. They just leave the classroom because they know they're coming to see me at a certain time or the counselor at a certain time, and then they go back. So it is completely private and confidential. The rest of the class doesn't need to know if they don't want to. However, to be truthful, we find the kids are often saying, can I go with you next, miss? Or sir, can I come with you because I have something I want to talk about. We try to normalize it as much as possible so it's a more comfortable experience. But absolutely, if they do not want to access school supports, the school counselor and the teacher will connect the parent with external supports in the community.
Okay, and I also have a question here about, can you tell us how many school counselors there are and how parents can connect with them?
Absolutely. We have 16 schools and we have about in total 21 counselors. So that is counselors, and some of them are counseling therapists. And the difference being is, again, the therapists do actual therapy, which takes longer. Whereas with the counselors, it may be a quick 15, 20-minute check-in with a child, start doing some regulation activities with them to calm them down, maybe working through some of those soothing type things so that they're able to be primed, get back into that thinking brain and back into the classroom so that they can do their work. So we do have 21, I do believe, in total in our system. And sorry, there was a part 2 to that question. Can you remind me?
Yeah, how can parents contact or get connected to the school counselors?
Absolutely. So that's very easy. You just talk to your child's teacher, or you go to the main office and say, I would like my child to start seeing the school counselor. It's very, very easy.
Perfect. A question here, what are some of the most common mental health issues that you see in teenagers? And can you speak a little bit to the impacts of COVID on the mental health of students?
Great questions. Very good questions. I think it's going to be no surprise to a lot of you that anxiety is higher. We see that there's a significant amount of anxiety, partially because of COVID and all that it brings, and the risk and the fear and the safety factor, partially because of going from online learning to back in the classroom. That takes a toll on us. As human beings, we're social by nature. And when we retreat and we move away for a bit and we kind of get tucked in our own bubbles within our family, and then we're asked to come back out, that sometimes raises our anxiety. So our teens feel a lot of pressure to not only succeed, they're starting to look at their academics for their trajectory of their college and university years. They're feeling like they're getting behind, and they are worried that they're not going to be able to catch up. That is one of the biggest concerns I hear from teens is, how can I catch up? And one of the things we say as counselors to them is, we're all in this together, and we are all behind academically. And I know that may not make a person feel better in the sense that you're not giving them a solution, but we plan our academics according to that. Our teachers understand that. And so they understand that one student may be at a grade 7 level and another student may be at a grade 8 level. And so they learn to teach based on that. And so we try to explain that to students, that we meet them where they're at. But anxiety does get higher. And because this generation has technology, they tend to hide behind their phones, and that's their safety net. And then having to come out into the real world again and interacting socially can be challenging. I know for me as an adult, it's challenging for me because I've been isolated over the last year and a half. So even sometimes going to a noisy grocery store sometimes makes my anxiety get a little bit higher. So it's legitimate reasons for why teenagers are concerned right now. They have a lot of stressors just because they're teenagers and they're trying to figure out so many things. But then the added stress because of COVID has impacted them, and they need the support. That's why a presentation like this today is so important, so that families know that there is mental health and parent and counseling support for their children in all throughout the community, not just FMPSD.
Great question and great response as well. Another question here, how can we motivate teenagers for study when a lot of them are, experiencing gaps academically right now, but also because of the anxiety that they have?
Oh, another great question. I could speak to this because I have 5 children of my own, and they're all teenagers and above. My children are teenagers to young adults now, and it is the $1 million question. I mean, I think it's as old as time. How do we motivate our teenagers, period, is a challenge because they're going through so much and they are struggling to try to find themselves. But to motivate them in a time where they may already be feeling less than because they academically feel like they're behind can be very challenging for them. It's validation. In one word, validating and saying, I know it's very difficult for you. However, I spoke to your teacher and I asked them if they can give us some material so I could help you. I will support you. Or if the parent feels they just cannot support, it's, I've reached out to your teacher. We're going to have so-and-so an extra EA education assistant, or we're going to have somebody in the school work with you and do some extra studies. Or maybe it's just aligning with a peer who may not struggle in that work area, that they could start doing some studies together. But the teachers will help bridge where the student is. The counselors will help bridge where the mental health, anxiety, and worry is. And then if we're working as a team and the family is talking to the school, we can help the student overcome some of those fears and start building them with that confidence again of, I got this, I can do this, I'm capable of accomplishing anything.
Excellent. I have a question here about the increasing dependency on technology for students, and also noting that there's a lot more use of technology in schools as well. What is the impact on the mental health of students with all this in this digital age and with all the digital fatigue, I would say?
Oh my goodness, yes, it is a double-edged sword for sure. We are so grateful that we have technology, because if we didn't, we wouldn't be able to do what we're doing today. So it has been a blessing. We've all learned to become very savvy with tech. Our children are unbelievably savvy. So I understand that it is a blessing to have the tech. However, on the downside, too much screen time, it has taken its toll on our children. Our younger ones are forgetting how to play and socialize, and those fundamental learning blocks that they need for life happen through their play, and they're not getting them if they're behind a screen all day. That's not a judgment. Please know that we are in a society, we're in a position now that we cannot let our children go out and play with people, and so we do the best we can within our own home. All I would recommend is, if there could be some limits on technology, I would recommend that, especially if your child is in online learning. If, say, for example, you have to do online for a while, I would highly encourage there to be time in moments with your kids, which means no technology and sitting together, whether it be playing a board game, maybe it's just chatting. With me, I have 5 kids, so I have a rotating door of kids coming in and chatting, my youth, my teenagers talking to me, and it's a rotating door of conversation. But the best way to regulate your child and to help them feel normative again is to connect with them and have conversations with them over and above what your expectations are for them. I'm going to say that again, because I think that's a really important piece. As parents, we see what we want, and we see the vision of the long term, and we want our children to succeed. So we may feel some pressure for them. I promise you our kids feel it too because of you. And it is important that they know that you're willing to detach from that and go, it's okay, we're in this together. Let's talk about your favorite TV show. Let's talk about something that's happening with your friend. It is those little conversations you have with your children that are the nonsensical, don't mean anything. Those are the connections that are going to get them through this. And if you talk to them about the little things, when the big things happen, they'll come to you. They'll come to you because they know they could trust you with the big things, because you're talking to them and you're interested in their life. So veering away from technology as much as you can is important, but recognizing it does have a place, especially in the school.
Yeah, some great advice there for sure. I think we're definitely living in a very in a world where there's a lot of distractions now, and not just for young individuals, but for us as adults too. So definitely good advice there. That's it for what I can see for questions. A lot of great information again. So thank you so much, Melanie, for coming and for sharing on behalf of the FMPSD. What we're going to do is we're going to take a quick break. So speaking of digital fatigue, I think it's time to give everyone a short break, and we will start our next presentation at 3 with waypoints. So if everybody wants to fill up their coffee or take a bio break, we'll be back to start at 3. Thank you. Okay, so it's 3 p.m. I'm hoping everyone had a chance to grab their coffee, like me. We're just going to jump right back in. So welcome back to Community Awareness for Mental Health Day virtual event. And we are now going to introduce Nicole Orji, who's the Outreach Manager with Waypoints, to lead us into the next presentation.
Wonderful. Thank you so much, Samra. Hello, good afternoon, everybody. Thank you so much for joining us today. As Samra mentioned, my name is Nicole Orji, and I am the Outreach Manager at Waypoints, located here in Fort McMurray on Treaty 8 territory. Wanted to acknowledge the land that we are gathering upon is the traditional lands of the Cree and the Dene, and the unceded territory of the Métis, and an ancient gathering place to many Indigenous peoples for thousands of years. So we're going to talk about Waypoints today. We're going to start big view, talk about the agency as a whole, and then go really narrow into our outreach counseling that's available for communities. So we'll go to the next slide, please. Wonderful, thank you. So in case you have not heard of Waypoints, we are a fairly large organization who has been serving the regional municipality of Wood Buffalo since 1982, when we first opened up the Unity House, our emergency women and children shelter. At Waypoints, our vision is a society free of domestic and sexual violence and homelessness. And our purpose, or our mission, is to lead in improving the safety, health, and well-being of individuals, families, and communities. I know sometimes that these topics are difficult to talk about, but hopefully we are trying to break free of the stigma and taking mental health and domestic violence out of the shadows of the home and bringing it into the public light, where we can have safety in order to talk about these topics. Thank you. Next slide. So in case, again, you haven't heard of Waypoints, we work for family violence. We include Unity House, which is our emergency women and children shelter. We have our second stage shelter, which is a transitional house for women exiting Unity House who may need additional supports or resources and safety measures. We also have the Opportunities for Change program, which is a court-mandated program for folks who have used violence in their relationship. So sometimes they may be called the offender or the perpetrator, but we like to use a person-centered language. So it's the person who used violence in the relationship. And that's a psychoeducational program to help them choose to not use violence in the future. Then we do have the outreach program, which I'll talk a bit about. Next, under sexual violence, we have our sexual assault and abuse program, and that is for people who have experienced either a recent sexual violence incident or maybe a historical experience. And we're very proud to have recently opened the doors to the region's first and only Child and Youth Advocacy Center. And so this is a safe space for children and youth who have either experienced a form of violence or maybe they have witnessed a form of violence and they're needing to have wraparound supports with, say, children's services, RCMP officers, and of course, Waypoints friendly staff. And then houselessness or homelessness. Again, we have Unity House, which is the emergency women and children shelter. And sometimes we find ourselves in precarious situations and maybe home is not an option. And so we have Unity House. And some of you may be familiar with the Compass, which is located up in Timberlea, and it is our affordable housing complex where we have rent. It's about 20% lower than fair market value, and we also accept Housing First clients there. Thank you. So again, the outreach program, we offer free services through all of Fort McMurray and all 5 of our rural and First Nations communities. Within the outreach program, I do want to remind everyone a few different times that this is all free services. So we have short-term and long-term services, and no matter how long you work in our programs, they're always free of charge. So we do have counseling for individuals seeking mental health support. We also have psychoeducation and support services for individuals who have been impacted by family violence. And that could be, something you experienced as a young child in your family, or that might be a recent experience that somebody has had that you would like more information about. We also offer public education and programs. So we go into schools, we go into community groups like the YMCA, and we talk about mental health and we talk about family violence, again, to try to break some of that stigma away. We do community awareness and training, something like what we're doing here together today, which I think is pretty fabulous. We also offer follow-up services for transitioned clients. And what this means is when women go into Unity House or the emergency shelter, they get support in-house. So when a woman and her children exit, sometimes they don't know how to navigate different systems. And that's when the outreach program can work with them when they have transitioned out of the shelter. And lastly, again, we do all of these activities and events throughout the entire regional municipality of Wood Buffalo. So all the way up to Fort Chipewyan, which is our fly-in, fly-out community, and all the way down to Conklin, which is about 2 hours south on Highway 881. Thank you. Next slide. Perfect. So a little bit more about our outreach program. Again, those are all of the communities I just mentioned. Of course, I'll be remiss if I didn't say this was pre-COVID times. Since COVID, as you can tell, we are also working from home. So that's really just trying to maintain everybody's health and safety. But in the event we have clients who are not able to meet in their home or on video, our supports are available in person as well. So we are able to provide counseling or support services to survivors of family violence and abuse. So just to note, also November is Family Violence Prevention Month. So there's no better time actually to be talking about family violence, raising awareness about what it is, how to prevent it, and how to support people who might be experiencing it. Also available to anyone looking for therapeutic support on their mental health journey. I think it's important to remember that even though sometimes it's taboo to talk about, everybody has mental health. It's much like our physical health, and it's always there. Sometimes we may be healthier than other times, but it's nothing to have a stigma around, and it's nothing to be ashamed of, because sometimes we get a cold, and sometimes we may have some mental health challenges, and that's really what makes us human. And we hope to always try to educate, empower, and support survivors. And that really just means believing people and giving them that safe space to share what they feel comfortable sharing. Our staff also educate and raise awareness for agencies and other groups, much like the previous presentations were really about our community. We're really about collaboration and coordination and trying to meet people where they're at. And our services are available for all residents, regardless of race, religion, gender, or sexual identity, or their status in Canada. Thank you. I do want to talk a bit about one of our newest programs. It's called the Domestic Abuse Response Team, and this is in collaboration with the hospital or with the Northern Lights Regional Health Center. And so we have the ability to respond in the hospital to somebody who may be presenting with a concern of family violence, or maybe who has experienced a recent incident. And so the goal of that responder is to consult. They consult with nurses and practitioners. For example, if somebody's showing up and they are not too sure, they can just have that phone call and that conversation. They're also able to respond to disclosures of violence upon a patient's consent. So they may come to the hospital, or they may talk to a client or patient on the phone about their recent experience. With that, they may also do some referrals. So to internal programs like our Unity House, or external agencies and services. Sometimes our friends over at the RCMP are involved, or other times really just getting them connected with a safety plan. And those responders are able to follow up within 24 hours, 2 weeks, 1 month, 3 months, and so on. And that is always with the client or patient's consent. So just wanted to share a little bit about this new program. We're very proud and excited. Family violence and mental health, they're both public health concerns. So the more supports we can get into our communities, the quicker we're able to respond and hopefully to help alleviate. Thank you. Our counselors. So we actually have 3 streams of counselors at Waypoints. We have our sexual assault program, which is for folks, survivors of sexual assault and abuse. We have our outreach program, and our child and youth trauma counselor provide free services for survivors of violence, for education, empowerment, and healing from whatever journey you may have been on. All of them focus on examining the impacts of trauma and providing the necessary skills and support to move forward. So trauma is not just an event, but it's how our bodies physically respond to this event and how it continues to linger on in both our bodies and our minds. And unfortunately, our outreach counseling is the only counseling service within Waypoints that's available to all residents of the RMWB. So what that means is our sexual assault program and our child and youth trauma counselors are only available in the city of Fort McMurray. But the great thing about this virtual world is, maybe somebody in a rural community has internet access and they're able to connect with the sexual assault program counselor now that a lot of our services have gone virtual. So again, it is that double-edged sword that Melanie talked about, where it's difficult. We've made these transitions, connections low, but we're getting amazing opportunities like being together today. Next slide. So our outreach counseling, like I said, we started at the top of Waypoints and we're going narrower in. So our outreach counseling is available. It's free and it's individual counseling to all genders, ages 10 and up. And that number, I put an asterisk there because it's not a definite number. If we have somebody who is 8 years old and they're not able to see a school counselor or they're not able to get another support, we will work with them. But as Melanie said, sometimes our littles need some play therapy or sand therapy and other modalities that our outreach counselors are just not trained in yet. But we always want to meet people where they are and they want to support people the best that we can. So again, that number is not a definitive number. And our counselors use a variety of techniques to assist in managing and resolving various experiences. So it may be talking, it may be art, it may be photography, it may be something called EMDR, which is eye movement deregulation. Don't quote me on that one, but there are a variety of techniques and modalities that our counselors utilize in order to help support the individual. They also provide short and long-term individual counseling for those who have experienced trauma. So EMDR can help process a specific event or a specific memory so that it's not as jarring for us. And they're available for a range of presenting concerns. So sometimes we may feel like, oh, it's just a loss of a job. It's not that big of a deal, but ambiguous loss is really difficult to deal with. So is anxiety. We have traumatic events that happen to us. We're no stranger to natural disasters within the community. And all of those may be reasons we seek out mental health counseling. Again, we have that family violence and we have so much more, and we're not limited in what we're going to see you for. Next, please. Wonderful. So sometimes it's really hard to access services in our community. There might be a lot of what we call that red tape or not sure how or who to reach out to. So we have a one-stop shop in order to access all of our counseling and all of our support services. And we do that via our systems navigator. So our systems navigator, her name is Samantha. She's our first point of contact for our outreach, for our sexual assault, and for our child trauma counselor. She is available by phone at 780-750-8888 8650 or at intake@waypointswb.ca. And that's all available on our website as well. So Samantha, when you meet with her or when you speak with her on the phone, she's going to ask some questions to better understand what supports are needed. So sometimes people come in thinking they need counseling, but really they just needed a couple referrals to the food bank and some different community sources. So we really work to try to understand each individual need, each individual's presenting concern, and what the best support is for them. That is also an opportunity to share some challenges the caller has been experiencing. So for example, if they've reached out to, a multitude of individuals and they have no support network, we're going to maybe triage them a little bit different than somebody who's connected to a psychiatrist or connected to another service provider. So we try to navigate the system and navigate that individual's own network as well. We also allow the caller to discuss some goals for counseling. So a lot of times it's really just to feel better, it's to cope, it's to get along better with our partners or our bosses or a range of things. And in order to have the best counseling experience, it's really good to have some ideas for what you would like to accomplish. And the systems navigator will assess whether Waypoint services can support these goals. So sometimes we are, mandated through our funding about what we can and cannot do. So sometimes we may not be the best suit or the most suitable service for that caller or that individual, but the systems navigator through these various questions will be able to assess and hopefully refer out and do a soft referral or phone with that individual to get that connection. Next, please. And that's actually everything. I feel like I zoomed by that, so my apologies. This is our phone number, or my phone number, just in case you would like to reach out. We do have a 24/7 family violence crisis line. Thank you. Yeah, we do have a 24/7 family violence crisis line that you can reach out to. Again, we know it happens. Family violence happens to anybody and everybody. There is no shame. There is no stigma. We are here to support you, and our shelter and our crisis lines are open, are available. And again, that's our systems navigator phone number. Thank you.
Thanks so much, Nicole, for sharing that information. I know firsthand the amazing work that Waypoints does, as we've definitely moved many individuals through your programs and services, receiving amazing support. So appreciate everything you've shared. And we do have a bunch of questions for you here. So the first question, some men may think that you only help women. Can you explain what help is available for men or the family unit?
Absolutely. So again, that's such a good question. And that's something we really want to get across too, is family violence does happen to everybody. It doesn't just happen to women. And when it happens to men, it's unfortunate that we don't have a men's shelter here in community. We recognize this is a gap, especially for those experiencing violence. But our support services are available to men. So they can call our systems navigator and we will serve them and support, assist, and believe men just like we do any other survivor. And for the family unit, again, support services, we would like to work with agencies through the Family Resource Network in order to potentially arrange safe visitations or, really working with the family to determine what the best course of action is, but always maintaining that sense of safety for folks.
Thanks, Nicole. Such important information, because I do think that there's kind of that idea that your organization serves one group, but that's great to hear. Do you have marriage counseling to bring families together?
We don't necessarily have marriage counseling to bring families together, but our counselors are able to do couples counseling. We just need to probably do some things to maintain safety or to ensure that there's safety. But yes, we can absolutely work with a couple, work with the family in order to help create a healthy relationship and maybe find some helpful communication in there as well.
Perfect. is there a time limit to the length of stay at the shelter, and where do individuals move on to from there?
Such a good question. Thank you. So typically our emergency women and children's shelter allows a woman to stay for up to 3 weeks. So 21 days. Of course, if in the meantime, something comes up and they need an additional couple of days, couple of weeks, we can work with that. Where they transition on to, well, good question. Sometimes it's to our second stage shelter. And so that's available if they need additional safety supports, if they need additional resources. They may not be free from the violence, and so they can transition to our second stage housing. Or we can work with, landlords. We work with Wood Buffalo Housing. Sometimes they move on and just gain their own independence from the work that we're doing together. So, or other times it's realizing that Fort McMurray is not the ideal community to be living in at this time. And so it's maybe working with Alberta Works or another service provider to help get them to another community for safety.
Absolutely. In terms of, we're hearing a lot about the increase in instances of domestic violence during the pandemic. Can you speak a little bit to that and our experience here?
Yeah. Oh my gosh, you all have such good questions. Thank you so much. So this is it's a concern of ours because we know that within any emergency, we saw it after the wildfire, and in other countries, even after natural disasters, domestic or family violence increases by up to 20 to 25% because there's so many additional stressors. COVID presents its own unique challenges because all we've been told for about 19 months is stay home, stay safe, stay indoors. And we are recognizing home isn't always safe for people. And that's where that increased rates of violence is coming in. Whether it's because people are scared of catching COVID, we haven't seen those numbers coming into our shelter. And we haven't seen those numbers reaching out to our outreach program. Where we are seeing the increase is in our crisis line calls. So the calls coming into our crisis line are greater than in previous years, but the folks presenting to shelter are less actually. And we think it's because they don't have the same opportunities for intervention. They don't get to go to a hairdresser and have that informal conversation and get this crisis line number. And so it's almost this perfect storm, this breeding ground for family violence right now. So that's why I'm here to just say, if anybody or if you are experiencing violence, there are supports available, and you're not alone in this. And I hope that answers that question well enough.
Yeah, absolutely. Thanks for that, Nicole. Another question here is, do you have cultural friendly counseling for individuals and groups?
Mm-hmm. So we try our best. All of our counselors have gone through the cultural awareness or competency training with the MCA. We have been trying to become more culturally safe. I think one thing is to be culturally aware, but we want to be culturally safe for people as well and recognize the different ways in which we may communicate. But that's as far as we go. We do have translators and we have lines that we can call in order to assist to get that translation in there. But all of our counselors are professional in that they also are aware of the variety of cultures, religions, and backgrounds that our clients and community members may present with.
Absolutely. And just by nature of the work that you do, they would be more attuned to a lot of those different factors, right?
Absolutely.
Yeah. Do you have the authority to intervene if reported about domestic abuse via a third party?
Not really. If that would be the case, if you should say, as a Canadian living in Canada, regardless of our status, if it's a child, there's a duty to report. So if by any chance we know of a child who may be exposed or experiencing violence, there is a duty to report that. As for the intervention, unfortunately, that's not in the nature of our job. We're more to do the prevention side of things than the treatment side of things and work to prevent the safety, but we're not able to go into people's homes or to intervene in relationships in that type of way.
Thanks, Nicole. What kind of safety plans do you create for individuals in crisis?
Yeah, so I would say it would really depend. I mean, our staff are versed in safety plans for folks who may be contemplating suicide or have suicidal ideation, and putting some context and safety plans into place there. We may have a 24-hour safety plan for a woman who just exited the shelter, and is going home to that unsafe home. And it's a 24-hour, if this happens, this is what you do. Or it could be a woman who is leaving an abusive relationship, who is not exiting, going into the shelter. And so we do things like important contact numbers, pieces of ID and things like this. Maybe you have children and you need to prepare how to get your children to safety. Or you haven't seen her, but I have a fur baby. What would I do with my fur baby if I was in an unhealthy or unsafe home? So those are the various ways we safety plan. And again, it's really unique to that individual.
Thanks, Nicole. And another question here I have is, have you ever utilized the services of the imam or markaz in this case? I think it's referring to help resolve or work through issues of family violence within the Muslim community?
We have not, but we recently went for a tour and a presentation of the Masjid with the Imam, and we're really hopeful that we can help bridge this gap and have these informal and formal supports within our network as well. We know that we're stronger and we're better together, so we are hoping, if the invitation and the opportunity is ever there, to be able to work closely with the Masjid and with our local Muslim community and faith leaders.
And speaking on behalf of Markaz, I know that they would be more than willing and open to also support that and provide some of that level of expertise in terms of the religious and cultural sensitivities for these communities. So great connection there, I think. The last question I have here for you, Nicole, today is, what about families who are struggling with homelessness and may need shelter? What is available to them?
That's a really good and tough question. So unfortunately, we don't have a lot of family-friendly shelters here. We have, emergency shelters for folks experiencing homelessness and for folks experiencing crisis, but nothing that would be necessarily safe for their appropriate for the entire family unit to be going. So we would try our best to work with the municipality, with the Salvation Army, potentially Alberta Works, with a lot of our community partners to see what we can do, even if it's reaching out to, a particular faith group. We have Wood Buffalo Housing contacts. And we also work with a group called the Coordinated Access Services Team. And so that's a local group of service providers who work within the housing industry, and we're able to do referrals and connections in order to help ensure we get folks safely housed, and that would include for a family.
Excellent. So bottom line is there's a lot of services available, and if in doubt, contact so we can find out what they can access and get supports.
Absolutely. I always say, even if I or we are not the right people, we are right people, so we will help get that information in a timely, appropriate, and hopefully kind manner, because we can only use a little bit more kindness these days.
Absolutely. So thank you so much, Nicole, for sharing that information and for supporting this event today. Really good information, and I'm sure we'll be having more of these types of conversations moving forward. Next presentation, so we're going to jump right into our next presentation, which is with the RCMP. So Justin Robertson, who's a constable with the Wood Buffalo RCMP detachment. So Justin, I'm going to pull up your PowerPoint here and you're good to go.
Thank you very much. Can you guys see my screen? It's not showing up for me.
Oh, I have it shared on my screen for you, Justin. Yeah.
Okay, so first off, I want to thank the organizer for inviting us to this. As the RCMP, we get invited to talk about a lot of different topics, everything from, fraud to winter driving, cyberbullying, but we don't get to talk about a lot of mental health. And I think it's still a bit of a stigma in North American society to want to talk about problems you may be having. Could you go to the first slide, please? Oh, this is not the slide, or that's not the presentation. Yeah, that's the Charter of Rights and Freedoms presentation. I think you could have sent the wrong one.
That's
is it possible?
very possible. I'll stop sharing and you can share your screen then, Justin.
Okay. Looks like I'm disabled from sharing.
Joys of virtual world. I'm going to see if I can give you the ability to share your screen. Can you try that now?
Let's see. I'm not great with technology, so we'll see how this goes. Can you see my PowerPoint now?
Yes, perfect. Thanks.
Awesome. So I guess I jumped ahead a bit, but my name's Constable Justin Robertson. I've been a member here in Fort McMurray for the last 11 years, and I've gotten to experience all those traumatic events that some of the other presenters mentioned, the fires, the floods, everything to do with COVID. There we go. So talk about it. Any time is a good time to talk about the importance of taking care of our well-being. This includes our physical and mental health. It's really easy to take care of your physical health because it's signs that you can see. I know I have to go to the gym more because my clothes are getting a bit tight. But mental health is a lot harder for us to notice when it's starting to depreciate. None of us are immune to dealing with mental health issues and shouldn't hesitate to seek support when needed. A lot of times, at least within the RCMP, we could be reluctant to seek help in regards to mental health issues because it's not something you can easily see. Therefore, we may not believe people, or we may not think people will believe us when we say we have these issues. I break my arm, you see my arm in a cast, okay, he's injured himself. That's why he's off work, or that's why he's on light duties. But maybe I suffer from anxiety, depression, suicidal thoughts. Those things are a lot harder, to show. So as first responders, we're typically the frontline primary response to a mental health issue, whether that's, episode of excited delirium. It could be a suicidal individual, someone suffering from a mental health disorder like schizophrenia. We show up on scene first. EMS, firefighters, nurses, they stage behind us until it's safe for them to come on scene. So it's really important that RCMP members are educated and trained on how to deal with different people's issues. So if I show up to, an assault, there's a way I'm going to approach that and address it. And it's going to be different than if I show up to a rambunctious teenage party, right? Not every call for service is dealt with the same way. So we actually go through a bunch of different training, most of it online right now, on dealing with things ranging from excited delirium to Alzheimer's and dementia. Typically what will happen is we show up first on scene and we engage with the individual. We'll try a bunch of de-escalation techniques, and we want to ensure the scene's safe so that we can bring in our other community partners to help. That could be EMS in case they've injured themselves or maybe they need to attend the hospital. Or it could be someone from our crisis outreach team. We'll bring a nurse in to assess the individual. So in Alberta, we actually have what's called a Form 10. So if I believe someone is a danger to themselves or the public due to mental health issues, I can actually complete a Form 10 and take them to the hospital for a mandatory assessment. That's where a crisis nurse will talk to them and see if they are, a danger. Are they suicidal? Are they having some kind of mental episode that'll put themselves in danger? That could be everything from, like I said, someone being suicidal to maybe someone with a mental health disorder that's not taking their medication. So I've dealt with any possible situation you can think of, everything from, like I said, suicidal people to people in excited delirium, people suffering from schizophrenia where they are having audio and visual hallucinations. It's important to note though that as the RCMP, we don't diagnose these things. I can't go to someone's house and say, yes, this individual is suffering from A, B, or C. I'm just there to attend, assist, and help the individual get access to the appropriate resources. Sometimes in order for them to get access, I may have to apprehend them under a Mental Health Act or under the Alberta Mental Health Act and forcefully take them to a hospital to get treatment. Sometimes it could be just me talking to them, realizing they're not a danger to themselves, they just have addiction issues, and calling around and seeing if I can get them a bed at a detox center. The detox centers are pretty good up here. Quite often I've called to see if they have a bed and just driven an individual there. So in 2020, there were over 20,000 files associated to the Mental Health Act. By September 2021, the Alberta RCMP had already responded to 16,908 such files. So those are files where someone is suffering from mental health issues, and we've either gone to do a welfare check, an apprehension, that kind of thing. So if you do the math quick, you're looking at around, for 2020, you were looking at around 1,200, 1,300 files a month. And by September, by September 2021, we'd already seen around 1,700 files a month. So we've seen an increase, and a lot of that has been brought on by the extra stress COVID has caused, with the restrictions, the reduction in services, people losing their jobs, some people being forced to stay in unhealthy households. I'm not sure if anyone's ever utilized the service, but we have what's called the Wood Buffalo Victim Services Unit here in the detachment. And so as the RCMP, we rely on the Victim Services Unit to assist us with, or assist us in helping victims of crime or traumatic events. These victim service members will provide support, information, and referrals based on the victim's needs. It's really important that we as the RCMP have these different partnerships, because as you might have guessed, the RCMP is not amazing at dealing with everything, right? I'm a police officer. I'm not a counselor. I am not a doctor. So I need to have support from all those individuals. I can show up and arrest somebody for committing an offense, but I can't counsel them through their marriage problems. Another thing about just being the RCMP is not everyone wants to deal with the police. Not everyone is going to like the police. So it's great when we have other support services we can refer people to. And the Victim Services Unit here assists with everybody in the Wood Buffalo region. So from Fort Chip down to Conklin, anyone in the region is entitled to the service. RCMP detachments in other areas such as, Cochrane, Airdrie, Sherwood Park, the rest of Canada, they all have their own individual victim service units. So how can someone like the Victim Services help? They provide a listening ear. They provide empathy, comfort, and reassurance. Sometimes there's someone that will just sit there and listen to what's going on in your life, what's affecting you. We can't fix all problems, but we can at least offer a listening ear. They'll assist victims with the court preparation program. So if you're a victim of an offense, we may need to compel you to court to provide testimony. Victim Services will sit with you while you're at court. They will walk you through the process. They will review statements with you. things to help you feel comfortable and confident to go in and present your testimony. They'll also update you on the outcome of files or the investigational process. And we as the RCMP do personal safety plans as well with victims at risk, but they can take it a step further. They can also provide information and referrals to different services, such as general police procedures in the criminal justice system. Unless you're involved in the criminal justice system, you're very unlikely to know how it works. And thanks to TV, movies, detective novels, a lot of what we do as police has either been exaggerated or blown out of proportion, or has kind of misled the public. They'll talk, or they can help you complete victim impact statements. So let's say you're a victim of a criminal offense. If that person is convicted in court, you will be provided a chance to either have or to read or have your victim impact statement read. So you get to go up and tell the accused and tell the rest of the courtroom how being a victim of this crime has affected you. So it could have given you PTSD, it could have caused you a financial burden, it could have changed your life in significant ways. So it's your chance to get up there and tell people how you feel. They can refer you to financial benefit programs such as the crime restitution or criminal crime restitution. They can help you fill out restitution claims. So if someone's convicted for, say, breaking your window, or someone's convicted of mischief, they broke your windows, they could be ordered by the courts to pay the cost to repair them or any other bills you suffered. Our victim services unit works quite closely with all the other organized or support services in town, so they can help put referrals into Waypoints, the Unity House, Choices, Legal Aid, and other support groups. Quite often, if I run into a problem that I've never dealt with, or I'm not sure what services are available, I go talk to the victim services folks, and they can tell me, A, B, and C is available, and here's their number if you want to pass it along. They really do take a huge amount of work off our plate as police. So here's something interesting. RCMP RPAC, the Royal Police and Crisis Team, known as RPAC, is a partnership between the RCMP Alberta Health Services, so AHS, and the team consists of one RCMP constable and one AHS mental health therapist. This has been implemented in a few detachments across the province, with Fort McMurray's team being in the early stages. We're still going through the MOU process, memorandum of understanding, getting the positions funding, that kind of thing. But we hope to get the team up and running so they can respond to mental health complaints. Responding to mental health calls through RPAC can impact outcomes. It is most appropriate to offer a collaborative approach, pairing police with professionals to provide mental health assessments. Police and crisis team mental health professionals provide a level of clinical expertise that enables comprehensive support for the individual in a crisis. As well, given the unpredictability and volatility associated with the response to the mental health crisis, the combined expertise of police and mental health professionals helps to increase the safety of those involved. So, like what I said earlier, the RCMP responds to criminal offenses. And we can be very good at investigating crimes, but we're not an expert in everything. That's where the crisis nurses we bring in are super helpful. They can identify signs we miss, that someone could be a danger to themselves, or maybe they're not telling us the truth. They can actually diagnose people. And they are, a friendly face that people may be more likely to engage with us, because people see the police and right away they think they're in trouble, where people associate nurses with them being there to help them. So what would typically happen in a program like this, we'd receive a call for, say, someone that was suicidal. We'd attend their residence. The RCMP officer would ensure the scene was safe and there was, nothing violent was going on and there would be no risk of injuries. And then the the nurse or the therapist would come in and engage with the client and, you know, determine if they need to go to the hospital or if they should, or if they could be referred to counseling, that kind of thing. So mental health within the RCMP. Unfortunately, RCMP work involves inherent risks, and these can sometimes be a contributing factor to mental illness / injury. In these situations, there are extra supports available to our members. So as you can imagine, RCMP members, along with other first responders, see a lot of traumatic events. We attend a lot of traumatic events, and that'll start, and then you see enough of it, it starts to weigh heavy on you. So there's been a big push for mental health within the RCMP in the last few years. You know, speaking out, telling our coworkers or supervisors, you know, how we're feeling if we're not doing great, and seeking that help. And we actually have quite a few services available within the detachment and, you know, on a national level. We have teams of dedicated individuals that out of our K Division Health Services that'll deal with, you know, our psychological health, our physical health, and help us keep up our resilience. It's been a few years since I've seen the statistic, but at one time, RCMP officers were the second most likely professions to commit suicide, just behind dental hygienists. So it's really important that we reach out to not only members of the public, but, you know, our coworkers who may need help. I can say, though, in the last 11 years, I've seen a big shift toward being open about your problems and seeking help. You know, at one time, there was the mentality of where you soldier through the problem. You don't whine, you don't worry about it, you put it at the back of your skull, and you just do the job you have to do. You help who needs the help. And, you know, we've learned over the last few years that that's not well, we've probably always known, but it's not a healthy way to live your life by trying to just lock away problems and not deal with them. And the healthier we as RCMP members are, the better we're going to be able to assist those people in the public that need our help. If I'm, you know, unhealthy member, I'm not going to be able to provide a great service to those people in the community that I serve. Keep talking. We are in an exceptionally challenging and unique time. Reaching out for help, especially when you're feeling low, can be very difficult. You know, and I mentioned it earlier, but a lot of times people will feel shame that there's something wrong with them, or they feel there could be some, or that they shouldn't feel this way when, you know, their coworkers don't. And, you know, everyone's different. Things affect us differently. So it's okay for us to acknowledge we have issues and to get the help, or to look for ways to address them in healthy ways, right? Not just self-medicating through, you know, alcohol or drugs. So here's always the funnest part. Anyone have questions for me?
And yes, we do. And thank you so much for that information, Justin. I think oftentimes when people think of RCMP, they tend to think policing and enforcement, and they don't usually see the bigger picture or the wholesome role that RCMP play in the community. And some of what you shared is really very valuable information. So first question I have for you here is, does the RCMP track mental health files in the RMWB? And if so, is there a trend?
So we have what's called a PROS system. So any call for service that we attend, even if we're stood, or even if we receive a complaint and then we're stood down, we keep record of. So depending on the type of file, we could keep it for a couple years or indefinitely. And yes, we have seen an increase for, you know, in complaints of different mental health issues and related to domestic violence.
Okay, thank you. How do you work with a person who, due to their culture, might deny having mental health issues or refuse any help?
Well, quite often we just have to find ways to reach people. So you may not talk to me because, you know, I'm a white male. Maybe you can't identify with me. Maybe it was a male that hurt you, for example. So we will find a member that you are comfortable with, or We could find someone that can assist us, like someone from victim services. We don't just give up on people. Doesn't matter how much work it's going to take or what resources we have to bring in, we will find a way to assist you. Does that answer your question?
Yes, absolutely. Thank you. Another question here I have is, do RCMP officers undergo crisis intervention training and recognize mental health issues when called for an incident?
Yes, we have both optional and mandatory courses and training we have to take. So, for example, dealing with excited delirium is a mandatory course that all RCMP members have to take. But then there's an optional course where you learn the signs of Alzheimer's and dementia, and recommended ways to interact with those people.
Okay. If we have an adult family member who is mentally ill, but themselves don't want any action, can we call the RCMP to take them to the hospital?
So in order for me to forcefully or to apprehend someone and bring them to the hospital, they have to be either living a lifestyle that's detrimental to their health. So that's the like hoarders you see, or someone living in filth. Or they have to be an immediate danger to themselves, like suicidal people, or to the public. So, you know, maybe someone having an excited, or someone that's going through excited delirium. If people aren't, or if it's not an immediate danger, you could actually apply for a Form 7 through the courts. And if it's granted, basically a warrant will go out for their arrest and the police can execute it, take them to the hospital. But we usually use the Form 10s as a last resort when someone refuses to get help, but they're in danger. We prefer to, you know, work with somebody and have them go to the hospital under their, or agree to go to the hospital, we'll say, because, you know, people that want help are more likely to be able to help.
For sure.
And something I should have mentioned at the end of my presentation, but I kind of got sidetracked, was obviously if anyone ever is in an emergency and needs assistance from the RCMP or any other police force, 911, it's a national number. It'll connect you to your nearest police force, ambulance, firefighters, all those guys. If you have a non-emergency complaint, so maybe you want information, maybe you have to report like a minor crime, you can call the number at the bottom of the slide, which is 780-788-4040. And you can actually use that number to be forwarded to victim services as well, if you wanted to talk to them. Sorry about that. Do you have any more questions?
Worries. Yeah, in your experience, is it harder for men to accept help or talk about their mental health?
In my personal experience, yes. I think there's still very much the mentality that, you know, we are men and we suck it up and we go and do what we have to do. I've dealt with individuals that have been, you know, they're men and they've been victims of domestic abuse, and they, honest to God, thought that the criminal code, women were allowed to assault men because, you know, men are typically bigger or stronger or whatnot. So we're trying to address that and deal with those problems, but that's going to take an entire shift in society before we stop seeing it.
Yeah,
but
absolutely.
All the services we offer to females of the public, we also offer to men or, you know, anyone else.
Okay. What kind of digital or online abuse is considered criminal?
Criminal harassment is one. So that's where you're constantly contacting somebody, you know, for the purpose of harassing them and make them feel bad. Uttering threats. So if I threaten to harm you in person or over the internet, it's still a criminal offense. Some of the newer laws are like releasing pornographic images of people without consent. You can be charged for that. Inciting hate, inciting genocide, or, you know, encouraging genocide. It's quite a few. And then there's everything related to, you know, the online frauds, theft of data, all that. I'd have to go through the criminal code and count all the individual offenses, but typically anything that's a non-physical offense can be applied to the internet.
Yeah, I'm thinking that might be a whole nother presentation.
Oh, yeah.
Is psychological or emotional abuse considered a crime?
It can be, and I'm not sure if I have a good answer to this, but harassment is a psychological, or takes a psychological toll on someone, right? So that's a crime. Emotional abuse, you could, like if someone's always yelling and swearing at you, refusing to stop, it could be considered mischief, obstructing the lawful enjoyment of the property. I can't think of any other good examples besides that off the top of my head. But if someone, or it should be mentioned that if someone reports something to us that's not necessarily in the realm of a criminal offense, we still try to assist them or forward them to the different support services, whether it's victim services or the other nonprofits in town. So I may not be the best person to deal with your marital issues, but I'm sure we can refer you to a service in town that is.
Okay. If conducting a wellness check on a family, does that result in an automatic referral to children's services?
With children under the, well, all children, I guess you'd say, are under the age 18 by definition, but yeah, any households we go to that where the child could be in some kind of danger or unsafe, we're required to put in a referral to child family services with the child's information, the parent's information, address, phone number, and a description of what took place. So if we find out there's a child, for example, that's in danger because their parents are heavy drug users, or maybe they are alcoholics and not looking after the child, then we have to put in a referral. If we show up at a place and the child's in immediate danger there, we may actually apprehend them ourselves. And I should note that when the RCMP deals with cases of domestic violence, so whether it's spouses threatening you, assaulting you, that kind of thing, we are mandated by policy to lay charges. So for example, if I find out that a wife has assaulted her husband, I am obligated to arrest her, charge her, compel her to court, and vice versa if the male's the suspect or the accused. Later on, the Crown prosecutor can review the file and they can determine if we should go through the court process, if we should apply for adult diversion, like anger management, that kind of thing.
Thank you. You touched a little bit on the impact to officers with everything that you deal with on a daily basis. So as an RCMP officer yourself, you've probably seen things the average person doesn't, which can cause more mental health issues. Are there RCMP officers who get affected so much that they're unable to return to their jobs? And what future options would they have for their careers?
So we have a duty to accommodate in the RCMP. So, and that goes for both mental health issues, psychological issues, and physical injuries. So if I break my back and I no longer can, I'm no longer physically fit for duty, the RCMP will try to accommodate me with meaningful work. So maybe I will, review domestic violence files. Maybe I will be some kind of, I could work at the front counter. And there's other instances. But if it comes to the point that I'm no longer comfortable working or they can't find me meaningful work, I may end up having to apply for a medical pension and retire medically from the RCMP. But I should note though that we're not just fired if we can no longer do the job. We have short-term medical leave. We have long-term medical leave. We have a whole range of different medical services. For example, I hurt my back last summer where I was off work for 30 days. When I returned, I worked a desk job out of uniform because my back was still healing. And I just reviewed files and I did I reviewed court packages and that kind of thing. And I was going to have to wait another 3 months for an MRI, but the RCMP was able to get me an MRI at a private clinic outside Edmonton. So they do a lot of different things that will speed your recovery and get you back to work. Because in the end, you know, they want us to return to work.
Excellent. Well, thank you so much, Justin, for sharing all of that information. And I'm glad I'm the one asking the questions, not answering them. Some really good and tough questions coming in, but we appreciate you joining us. I think, like I said, this goes a long way in building trust between the RCMP and the community. And so we really appreciate you coming in and sharing information about the RCMP beyond what most people know the RCMP does. So thank you so much for your time. If I could get you to stop sharing your screen, and then I'm going to try and figure out how to set mine up again before I introduce the next presenter.
Perfect. And I'm gonna stick around at the end if you have any other questions. So I'll see you then.
Thank you. Okay, so I think I'm hoping everybody can see my screen. Bushra, did that work?
Yes, we can see it.
Okay, perfect. Okay, so our last presentation for today, I'm going to introduce our local Imam with Markaz al-Islam, Imam Murad. He's born and raised in Vancouver, Canada, completed his first degree in Saudi Arabia in the field of Islamic law at the University of Imam Riyadh. He completed a master's degree in halal food research from the International Islamic University of Malaysia, and is currently completing a master's in counseling psychology with Yorkville University. He spent over 15 years in couples therapy, and as I mentioned, he's currently the Imam of Markaz al-Islam, and we are all very grateful to have his level of expertise in our community here. So with that, I'm going to hand it over to Sheikh Murad.
I hope that worked. Is my voice clear, and is the image clear as well?
Yes, yeah.
Okay. So, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. May peace be upon you all. The session that I have, or the few PowerPoint slides that I have today, are just, you can say, quick thoughts on the issue of mental wellness from an Islamic perspective. And before I do get to my slides, I just want to mention that we do have a vast wealth of scriptural passages that highlight the importance of this subject, that is mental wellness. Now, just to shed light on that, we have one of the shortest chapters in the Quran titled Al-Kawthar. Al-Kawthar, which is chapter 108, it was revealed to the Prophet after he had suffered greatly at the hands of Quraysh. They had put him down, spoke to him in a very horrid way, and he was extremely upset by the ordeal. So Allah then revealed this chapter to him, which in essence reminds him of all the great things that he has in his life. It gives him a practical method to enable him to overcome that anxiety, that stress that he was facing. So we have many chapters like this, many passages in the hadith that likewise speak of the, method with which a Muslim can overcome stress, various forms of anxiety. We also have something called the seerah. The seerah is the biography of the Prophet, which is a guideline for Muslims. So it tells us how the Prophet interacted with people, what he did, how he conducted himself, what practices he did in specific to overcome, certain issues that today would be considered, great mental issues or sources of mental strain. So we have that within the wealth of the Quran and the Sunnah. Now, although I'm saying this, we do have, certain taboos that are tied in. We'll speak about those in a bit. regarding what you can and cannot do with mental health. So as I'm saying this, I'm not saying that one should avoid seeking help. Rather, when the need is there, a person should seek help when they need to take help, because the Prophet directed us to seek help when we need it. We find the same commandment in the Quran, where Allah informs the believers that, فَاسْأَلُوا أَهْلَ الذِّكْرِ إِن كُنتُمْ لَا تَعْلَمُونَ, that you're to seek help. In that instance where you are unaware and do not know, you seek help. So yes, as a Muslim, it's not just a matter of taking by religious interventions, but rather one should take by every help that's available. If they are truly in need of help, they should not shy away. So that said, we'll move on to the first slide. So in terms of mental health, I want to go to a descriptive definition of the term. So here before you, you have Samuel Gladding's definition. This is found in the Counseling Dictionary. He defined mental health as a state of positive wellness and emotional well-being, free from excessive stress. Now, keep in mind, we live very busy lives. Our lives are full of worries and various stressors. These could pertain to your job security, family concerns. Add to all of this the stress of having to navigate COVID-19, not knowing if a shutdown will come, or I guess we've all heard the new strain now. I guess it was in South Africa, now in many parts of the world. So just having that on mind and being constantly inundated with all of this information, no doubt it's a cause for stress, definitely. And we all have our fair share of stress in our lives. So the United Nations put out a research study that I found quite interesting, actually. They're speaking about the various stressors. Sorry about that. Did it kind of, am I still, can you still hear me?
Still, yeah.
So United Nations put out a very interesting research study where they spoke of the rise or need for mental wellness, mental health, in light of the COVID-19 pandemic. We also have the researchers who have stated, and I'll read this is one of them is Winkler and his fellow study researchers. They stated in their study, it's about the rise or the need for more mental health, more mental, health counselors in the backdrop of COVID-19. They said our findings show that there will be a doubling or tripling of the prevalence of common mental illnesses. And this is in the backlight or the backdrop of COVID-19. So there's a lot that we have in our minds, definitely. And we have to seek that help if we need it. I mean, one should never shy away. One should not think that, well, this is something that's inappropriate and that we should only make dua to Allah or turn to Allah and supplicate to Him. Yes, that's part of the equation. But, if a person genuinely needs help, you turn and access that help that's available within the community. And we've heard many today. I was so thankful to hear a lot of that. The many resources that we have within our community that any one of us can access for free. This is something amazing, because in other parts of the world, this is not for free. You're going to be paying money for it. So that is, we're thankful for that. If you can move on to the next slide. So in light of what I've mentioned, that we do have, many passages in the Quran, in the prophetic tradition, the scriptural texts that speak of the importance of mental wellness overall. This is the statement for a classical scholar, Ibn Hazm. Ibn Hazm is, he's written in many fields. So his statement here, it states, meaning of which, I search for the common goal amongst humanity, or amongst humanity that they would all agree upon and seek zealously. And I found it to be only one thing, their desire to overcome and vanquish anxiety. Interestingly, we have many scholars within the wealth of the Islamic, studies who have actually written on this subject, in detail. So overall, it's not something that's looked at as a taboo from our Islamic heritage point of view, but rather today, I guess, with cultures and whatnot, it is looked at differently. But in the past, scholars would openly speak about this issue and really, discuss it at great length. We can move on to the next slide. So as I mentioned, there's certain cultural taboos when one of us wants to seek, therapy, or they're referred to counseling services. Sometimes, a person who's in this condition that is told, okay, it's best that you do seek counseling or look for a therapist that can meet your needs and help you out. You find that they would be told, whether directly, indirectly, or it could just simply be a notion within culture, that this is shameful. You shouldn't be doing this. In a way, I mean, nowadays people would look at medical treatments and think, okay, that's something that we can live with. There's no problem with that, be it an operation, whatever it is. Sometimes I even think that, if a person was diagnosed with a severe illness, medical illness, that might be easier to bear than them being told that, you have to seek help because you have some mental illness, right? So there's a big taboo on that, because in the minds of some people, mental illness is not a thing. It's just something made up. And they'll even tell you, moving on to the third point I put over here, or one of the points I've mentioned, maybe I didn't mention, I did mention it here. They would say, for example, my parents never needed help, so why should I bother seeking help? If my mom and dad finds out that I'm seeking help of this nature, they'd make fun of me, and this is not right. Or sometimes, and this is really, to me, I lost for words, because some people might think that, the doctor has said that maybe you should seek, some therapy or counseling. And then they will come up and tell me, and I've had this experience more than once, and they'll tell you, Sheikh, I think that I need ruqya. Ruqya, for those of you who don't understand the Arabic word, it is a term that indicates, a spiritual treatment. Certain verses of the Quran are recited, and it brings a sense of peace to an individual. So they think the cure is simply and only in this. It works definitely, but then overall, not for everything. When a person needs serious help, in that case, you seek that help, as we said before. Not everything is basically, ruqya solved. There are things that need extra help. So looking at the next point over here, we have some, and I've heard this too, that was kind of shocking for me. My faith doesn't allow me to seek help for mental issues. There's no such thing. In fact, you are directed in the Quran, in the Sunnah, to basically seek help if you need that help. So don't bring about a faith-based reason why you cannot access mental help. Rather, there's no such thing that would prevent a Muslim from seeking that help. Some might say, this is I think the bigger issue, that I come from a culture where this is frowned upon. And the problem that, we do see within the community is that people, or some people, let me say, to be fair, confuse Islam with culture. And these are no doubt two sources of influence. And to a great extent, sometimes the two are confused, when in fact they are significantly separate and different from each other. Some might simply just think of the two as one, which is incorrect. So yeah, these are some of the cultural, or let me put overall, taboos within the community that may persist regarding, seeking help for mental illness and overall mental wellness. Muslims should, strive to achieve that within their own selves. Yeah, so these are just a few points. I know there are other points, but these are the ones that come to mind. So the way forward, as we said before, is that Islam is not against seeking help. Rather, you are encouraged to seek that help if you need it, definitely. And one thing that I guess many of us do not or may not understand is that there are, therapies out there where the religious component, your faith, is actually incorporated into the therapy itself. One of these is known as RCBT, or religious CBT. That's a cognitive behavior therapy. And the difference between this and other forms of therapy is that the religious beliefs that you hold to firmly and passionately believe in, they would serve as motivations to stimulate change in thought and behavior. So they can be incorporated. For us as Muslims, this is perfect, because faith is really something that we hold firmly to. And one can be motivated to change their thoughts and their behaviors, right? Those persistent thoughts and behaviors by using the Islamic faith, taking certain texts that would then encourage them to break that, the vicious cycle of negative thoughts and whatnot. So yes, there are certain therapies that are out there. Really, the biggest thing over here to get to this point is that you have to have a strong, and this is not just for our community, but for anyone in the field of, providing mental health. So counselors right now, the biggest issue that we as Muslims need for our communities is that, we have to have that strong therapeutic alliance between ourselves and the client. Part of that therapeutic alliance is for you to understand the culture, the religion of the clients that you are serving. More often than not, when a counselor does engage and does not have a complete or clear picture of the client, that would cause a break in that therapeutic alliance, and the client would not benefit. That's why we do hear sometimes that, I went to therapy, I went to counseling, I didn't benefit anything. The counselor did not know anything about my culture, my religion. Now, you're not required to be an expert, but there are certain points that a counselor should know about. So yeah, this can be easily incorporated, but it needs from the counselor to know certain things about the culture and religion of the client. I think we can move on. Yes, so although my presentation is a bit short, I think with all that we've heard today, as I say, khitamuhu misk, we come to the end of this presentation. And if you have any questions, feel free to ask. Thank you.
Jazakallah khair, Sheikh Murad. Thank you for a very important message, I think, for our entire community, especially when it comes to the stigma around mental health and accessing those supports. So it's good encouragement and reinforcement for our community. We do definitely have a bunch of questions coming in for you. First one I have here is, in certain cultures, they seem to shame mental illness or hide it. How can we help in such situations?
Well, I think in certain cultures, this I've seen it myself. One of the ways that we've used to counteract that shaming is by clearly informing the brothers or sisters who are involved that this is not part of your faith. Your faith is not put shame upon you for seeking help. So I think more often than not, that shame would be attached to the notion that Islam and culture are the same. When we kind of distinguish between the two and direct a person to that knowledge that there's no harm in seeking mental wellness treatments, I think in that case this would be greatly beneficial. That could be one step in the right direction.
Perfect. Another question here is, how can Markaz Ul-Islam help with encouraging and convincing people to seek help for a child that might be experiencing mental health issues?
Actually, sister, I just want to quote one thing over here. This is from a research study by Koenig, where he speaks about the impact of religion and spirituality upon the mental wellness field. He states over here that clergy have traditionally served as a frontline mental health providers in many communities across the United States. They provided many hours of counseling, and they spend consider that the clergy spend on average 15% of their time in counseling activities, providing over 140 million hours of mental health services each year, not including the activities of nearly 100,000 full-time chaplains and others who are like them. So yes, we are like a frontline, I guess, mental health, to an extent, mental health providers. And, when we do see children who are, or, I guess families who are suffering, we have to kind of direct them to the proper services. So here, in light of what we've heard today and all the various resources that we, I think, have taken note of, we will make a point of directing people to those proper services to guide them to the resources that we have within community, inshallah. So I think that's a very important first step.
Absolutely. Another question here, should people seek Islamic advice first or medical advice?
Well, I don't see any harm in seeking both at the same time. So like, let's say a person says, I think I have, this is I guess many of us will understand when I say this. We do come across cases where a person might think that they are possessed with a jinn, and they're convinced that they are possessed. Now, you know, the recitation will be read upon them, and if there's no result, we're going to tell them, you know what, in the end, you're perfectly fine from our point of view. You must go seek medical help. And that's when we have that pushback that, no, I know it's this. You can't do it properly. I'll go to someone else. That's when you have people, and these are not a very small percentage of the overall population of people who do seek, you know, these types of remedies. They're convinced in mind that it's got to be this, but in fact, it's actually a mental health problem that they have. So that's one of the things that we do face over here. Then that is, you know, people being convinced, and they believe that this is the approach. Whereas I personally don't feel that there's any, you know, conflict in a person seeking that mental assessment from a health provider, at the same time, you know, seeking some form of therapy from the local imam. And I think that would be a good mix. So they get that boost from the religious side of things to kind of encourage them forward. At the same time, they're seeking that proper medical wellness from a certified health provider.
Okay, and what about those that say depression is a sign of weakness in faith, or that depression doesn't exist in Islam?
This is absolutely false, erroneous. In fact, those who do peddle this idea are quite ignorant of the what we have in the Quran and also the prophetic traditions. So depression is really a thing. It does not need to be discussed. It's something, you know, firm. It cannot be simply put aside by reading the Quran. When a person needs help, they have to seek help. Sometimes, you know, of course, medical health providers have various remedies for and approaches to, you know, put a person on the right track. So anyone that does push that idea, I think they have to have a re-education as to what Islam says about depression overall.
Absolutely. In your experience as a local imam, what kinds of things are you seeing, or are Muslims showing in terms of mental health issues and trends?
There's a few things. I've shed light on one of them already, where people believe that they're possessed when they're not possessed, and they might have, you know, a certain mental health issue, and they have to go to, you know, a health provider. I've directed a few people that have come to me in this way to go seek help. So yeah, we do come across that instance. We have people, for example, who, you know, are on the opposite end, who believe they're perfectly fine. And it's only by virtue of their parents or their siblings who come to me and ask me, you know, can you look at so-and-so, he has an issue. And that person, you speak to them, they're completely adamant, I'm perfectly fine, I have nothing wrong, but everyone else around him is saying that something is wrong with him. So you have the two extremes over here. And I've seen both at the center. But mind you, these are not as common as it might sound right now. These are cases that I've come across over the course of 8 years, and I can maybe say a handful of cases like this. The vast majority of people who, you know, face an abnormal level of stress and anxiety, where they kind of are overcome by, you know, that anxiety, that stress. They might exhibit certain, you know, symptoms, excessive anger and whatnot. We deal with them quite easily because here we do have a lot of remedies within the wealth of our faith that direct a person in controlling these types of behaviors to limit the symptoms that they have and what they should do during situations like that. Likewise, we have couples therapy, which is, I think, one of the biggest issues that we face over here at Markaz. I think it's with common in every Muslim community, where you have, you know, many issues that do come up when it comes to, you know, marital discord and how to fix that. We've used, personally, what I use in terms of the couples therapy is solution-focused therapy. Well, solution-focused brief therapy, SFBT, which I found to be very effective with the couples that we deal with over here.
In your experience, do you feel that there's a disconnect between what youth are experiencing in terms of mental health and what adults or parents are willing to acknowledge?
That's always an issue, sister. I mean, in terms of, you know, what we see and what parents are willing to admit to, or individuals are willing to admit to, that always is there. And even when we do certain assessments to assess levels of, the stress, anxiety, you'll find some people not answering that truthfully, not that forthcoming. So that's always there, because the stigma is still attached to, the fact that, oh, this could be something shameful. So that is there definitely, and I can see that. And, we're working on that. It's a step-by-step process whereby we can get to a point where community, inshallah, will be more comfortable with these issues. Often we come across these issues where people think that, oh, this is un-Islamic because it's not prescribed in the Sunnah. Islamic faith does not mean that simply you take by what is mentioned in the Quran and Sunnah, but rather any means through which you can improve yourself and better yourself, that will be incorporated in the means that are allowed, for us to use. So, sometimes it's just a matter of explaining certain concepts to revisit them so that there is no misconception.
Yeah, absolutely. I think very important information. Do you see culture shock for newcomers, and is that a contributing factor to mental well-being?
I do believe so, sister, because, without mentioning countries that where newcomers are coming from, but I've dealt with many newcomers to Canada in my time in Vancouver, in Toronto, in Saskatchewan, and here in Alberta as well. The newcomers come with a specific set of problems, because from most of their countries, when they do arrive here in Canada, and they have unannounced or undeclared or unknown even health problems, mental health problems, and these are not recognized in their countries. They might think, oh, the person is crazy, or something is, he's just behaving bad because something happened. Otherwise, this is normal. So you'll find that certain attitudes and behaviors that we look upon over here in Canada as being problematic, or symptoms for a greater issue, and symptoms that would basically push us to tell those individuals go seek help. These same things are not viewed in the same way back, from in their country. So when they come over here, it's a whole new thing for them. So there's a lot of cultural shock per se when a person comes and they're told you got to seek help for A, B, and C. They're like, hold on a moment, my whole life, my mom and my dad, my family, we've all had the same thing. What's the big deal? So that's when we want to tell them that, Islamically speaking, we're trying to get to that point where you're feeling well and you have a state of complete calm. And, it's a challenge, definitely, but they're a different set of problems that, newcomers have. And I've noticed that, as opposed to people who've been maybe born and raised and have lived in a Western society. So there are differences, definitely.
And speaking of those born and raised in this country, the next question is, do you see those born here and those that are not going through identity crisis? So for those that are here but have cross-cultural identities?
Well, we do have, with our youth, we do have this issue that I guess it's a source of conflict and indecisiveness, and it brings a lot of anxiety and worry. First of all, you have a cultural identity that you want to upkeep and maintain. Then you have an Islamic identity that, you're told to upkeep and maintain. Then you have a Canadian identity that you're told to upkeep and maintain. So in the eyes of a youth, they might be holding several different personalities, or let me say, I'm just using it very loosely. So with their parents, they behave and conduct themselves in a certain way to kind of appease their cultural, I guess, to satisfy them culturally. And then when they come to the masjid to perform prayers and whatnot, they conduct themselves a little bit differently to leave a good impression upon the imam. And then when they're with their friends, maybe at school, they, gravitate towards a different direction in their personality overall. So that no doubt would be a source of, great confusion and anxiety, definitely, especially when they begin to collide and you're unable to come to terms with what you want to be or who you are going to be in those said moments. So, it's basically upon us, myself and the other imams, to kind of speak to that. And this is not I can't answer this as to how we do this all at once. There is an approach to this that, we can use, whereby, I can't explain it over here, but overall, there is an approach that we use at the mosque with our youth that limits and reduces that anxiety that they do experience when they come, when they're put in the path of this conflict.
Thank you for that. And then another question. We've heard from a lot of different agencies about the supports and services available in the community. If you could give one message to those service providers and community partners about the Muslim community and what they need to know when working with individuals from visible minorities or diverse backgrounds, what would that be?
Well, let me see. This is quite the question. I would say first and foremost that you have to understand that Fort McMurray is a very unique community. Not just in terms of, you know, the tight-knit nature of the community, but overall in terms of the various cultures that do reside here in Fort McMurray. So aside from, you know, Muslims, and I'm looking at the Muslim community, aside from Muslims being from the Muslim community, they adhere to a set, you know, a set of beliefs and, you know, perform the prayers in the same way. Aside from all of that, there are many differences among the various cultures within the community. And for a counselor who wants to get involved and help out, I think it's healthy for them to kind of understand and get to know the various cultures that you know, that reside here that is here in Fort McMurray. It was my shock when I first came to Fort McMurray. That was over, you know, 8 years ago. The first year that I was here, and I attended at least my first, it was end of the year school, the Islamic schools. They had the, what was it? The assembly, yeah. So in that assembly, they had all the kids dress up in the traditional clothing. And I believe then, if I'm not mistaken, it was over 30 cultures, ethnic cultures that were present here. And I wouldn't have known otherwise. It was only when I was there and I saw all those flags and the various cultural clothing that all the kids, you know, were wearing. That's when I was kind of shocked, taken aback that we have that many cultures here in Fort McMurray. And I knew all those, at least I recognized all those children and the parents because they performed prayer with us in the mosque. So to have in mind, look, the small community of Fort McMurray overall, it has a very diverse population of Muslims. Culturally speaking, there's a lot of differences between each of these cultures. So certain times you may believe that you got the hang of one culture, and then you might think, oh, it's the same as that one, but there's a pretty big divide between the two cultures, and you can't simply, what do you call it, brush over the two as if they're one. And I made that mistake because I was invited to a wedding, and I you know, sat with the without mentioning the country or the culture, but it was quite interesting. So I was invited to do the nikah, the religious ceremony. And then in that ceremony, you know, we're all speaking Arabic. So I assumed that the host was from a certain, you know, Arab background because of the accent that he was speaking with. So I asked him, after everything was said and done, are you from this country? He was so insulted. He said, of course not. Can't you tell I'm from this other country? I'm like, oh, you're actually neighbors. He said, no, we're not neighbors. And it was, I had to kind of control myself because I didn't want there to be a conflict on the day of that nikah. So yeah, sometimes you might assume certain things are all the same, but then there is actually a big divide. So my advice to the counselors out there who are getting involved in the community, get to know your crowd. I mean, come visit the mosque, speak with the imam, and get to know the different cultures that are present in the community. I think that would be, to sum it up, yeah.
Thank you so much. And my internet cut out just as you were ending there, which is telling me that we're getting close to the end. And you know, it's taking its toll on my computer now. But really, really good information. And I think I can't understate enough how important it is for you as the leader of the local mosque to be encouraging individuals to take help and to help shatter some of these stereotypes and stigma around mental health. And we have a lot of comments coming in that are reiterating that message, and especially from some of our youth that really appreciate you speaking to that today. So thank you so much for sharing. Yeah. We do have more questions, but what we're going to do is similar to before. We'll send them your way and have some responses posted online alongside the online recording. Okay, so we're at 4:34, and so there's just a few other things for closing here. I want to start by saying thank you to all our presenters today and the agencies for supporting this event. Dr. Ogunsina, Jackie and Jody from the CMHA, Melanie from FMPSD, Nicole from Waypoints, and Justin from the RCMP, and of course, Markul Islam Imam Abdurrahman Murad. We recognize that there are many other agencies and organizations in this community doing some excellent work and providing much needed supports and services, and organizations that likely you all want to hear from. And though they weren't able to be part of today's session, we hope to work with them to bring more sessions and share in more information in the future. I do want to say a special thank you to the team that worked tirelessly to plan and organize this event. So the Multicultural Association's project coordinator, Rima Qadri, Markazul Islam volunteers, including Brother Muhammad Al-Dabi, Bushra Irfan, Sheikh Murad, and Dr. Aruj, and all others that were involved in some way to support this. I am going to ask if Guy Chouquet is still online from the Red Cross to unmute and say give us some remarks.
Hello, thank you. No, I just wanted to share. Disasters have an impact on mental health. So if we reflect back a little bit on 2016, this whole community evacuated together. And the question that I have that I'm interested in exploring with your community is, was that evacuation the best way possible? If we're having evacuations in the future, which we had again in the floods, is there a way of being better prepared? So I think there's a conversation to be had of looking at the community, how well is the community prepared for disasters, and what are steps that could be taken to reduce that. Also interesting, some of the pillars of Islam, I would say the prayers and the aims have an impact on mental health, right? So if because of the flooding in 2020, the mosque downtown has been flooded and is accessible, and then COVID also reduces the ability to do in-person prayer, that has an impact, because prayers are not just prayers spiritual, re-energizing, but also you're able to connect with your peers at the same time. So being aware of those impacts, I think, are important in creating other opportunities for greater social connection. I have witnessed the generosity of the Islamic community, for example, during the floods when the Center of Hope had a challenge with COVID and needed extra supplies. Your community was one of the first to come up and support that. So those are all things that Dr. Ogunsina mentioned as being positive elements for mental health. He provided an excellent presentation, by the way. I've been doing disaster recovery and mental health for years, and I think his presentation is worthwhile listening to again. So when the recording comes back, I would just encourage people to listen to what he said. I think he had brilliant gems in what he was saying. And it's interesting, if I think of the organizations that presented, there seems to be a theme that's common, and they're all able to refer out to other agencies. So for me, that's important, because what that means is you don't have to really, am I going to the right agency? Because in fact, if you go to any of those agencies, they're able to refer out properly, including the schools. So I think that's important. And I think another part that's important is like engagement. So awareness and information is good, but engagement is another level. So I see, for example, the CMHA Recovery College, it kind of relies on volunteers to be peer support. So I think there's a great opportunity for members of the community to be more engaged. So in fact, what you end up doing is you end up having members of the community part of the Recovery College. So I would encourage that to explore that as a means of, I guess, creating better engagement and partnerships. Since we had a delegation from your community to the flood collaborative that occurred before summer, I feel that that's really opened a lot of bridges and a lot of conversations between the agencies. And I just think we're on the right path, and events like today are really, really important. And I really want to thank the organizers for this. I think it's very critical, it's foundational, and I just really appreciate it. So thank you very much.
Thanks, Guy, for those great reflections and on the session today. I'm going to check to see if Brother Muhammad Al-Dabi is online, a VP with Markazul Islam, and if you can say a few words.
Well, thank you so much, Sister Samra. It's been a pleasure to be part of this and part of this great initiative. I was stunned with the amount of tremendous information that we got here at once. And I could not believe that we have all these services at our fingertips that could be used by not only about the Muslim community, the whole community at large. I really appreciate everyone joining us in a weekend. And I really thank the volunteers. And as I said, this initiative should be repeated again with more agencies should come forward, and we will have it one more time. I can't wait for the recording to go out, and I know it's going to be, it's a big effect. It affected me personally right now, like just hearing all this. And we should have this recording like passed on to everybody. Well, thank you very much. I really thank you, Sister Samra, for stepping up and taking this role. Thank you so much to Sister Rima Qadri for all the work that she did, as well as thank you to Sister Bushra Irfan. And I really appreciate Sheikh Murad for backing us up with every little details that we needed him in. And as well as I thank deeply all the agencies that actually came in the weekend and took off from their time to show their support and to advertise and allow people to know what they're doing. Thank you very much.
Thank you so much for that. And I'm sure we can all agree that this is just the start, and this gives us an opportunity to continue to have more meaningful conversations and discussions and engagement for this community, and encouragement to access all the many supports and services that are available in this community. It's been an honor to represent Markaz al-Islam as your host today, and I want to thank everyone for being part of this and making it a successful event. And just a reminder that we did record the whole session. It will be posted online along with captioning as well as translation. And we will also take the questions and put them into a bit of a format so that we can post that alongside the recording for individuals, in addition to contact information for the various agencies. So again, thank you everyone for your time, for the presenters who spoke and shared a lot of valuable information, and to everybody that participated today. Thank you.
Okay, thank you so much, guys. Have a great night and enjoy the rest of the weekend.
You are a great hostess.
Thank you.
Thank you, everybody.
Great session, Sister Samra, and congratulations to you and Sister Rima. Great, really, really enjoyed. I heard everything. I was there the whole time, but wow, great information. This is needed for our community.
Thank you, Sister Meher, and thanks for staying for the whole session.
Yeah, I really loved it. I was looking forward to this session where all organizations together, and it's one platform for all parents to hear what our community is offering, and such a wonderful community we live in. So thank you. Especially over the weekend you planned, wonderful. And congratulations to you, Sister Rima. Yeah. Have a wonderful evening.
Thank you.
And Sister Samra, it's been quite an honor to be part of this, and I'm honored to meet all of you. Some wonderful connections, and I'm really happy that's going to be recorded and going out to all the communities. And hopefully it'll be an encouragement and a path forward. So a very, like I said, honored to meet each and every one of you. I know that we've put in a lot of work, and this is just a wonderful start.
And thank you for all the effort and work you put into getting this going, Rima. It wouldn't have been possible, I think, without your support. Is Sheikh Murad still online? I just need to know how to manage the rest of the recording.
I don't think he is.
I'm afraid if I log off, it's going to lose the recording.
I think you can just pause it and then or stop.
Let me just text him.
Yeah. I could stay on here until I know that the recording is safe. That goes for you too, Bushra, because I think we're both recording.
Yes, I'm just going to stop it from my side.